Hello, everyone. Today we're going to talk about sleep for peak performance. I'm a family physician and sports medicine physician, and what I have found in my regular practice in dealing with families and also dealing with elite athletes is that sleep is one of the least appreciated things for optimizing performance. Sleep is really, really underappreciated in terms of how important it is, how useful it is, how much benefit we get from proper sleep. And more than that, most people don't appreciate at all the problems they have when they don't sleep well. So, this talk today is going to be about secrets to being better in bed. I hope everybody would like to be better in bed. And there's lots of things that improve in our lives when we sleep well. And we suffer from many things: physical, emotional, psychological, and physiological when we're not sleeping well. So I'd like to explain to you today what we've learned about sleep, some of the things that we need to be aware of about sleep, what you need to be aware of to make sure that you're optimizing your own sleep. In athletics, here's a good example of a basketball team traveling, trying to get sleep in a cramped airplane, and you can imagine how they're going to perform that night on the basketball court. So this is just an example of the kind of things that we have to deal with in sports medicine. But in everyone's life, we find that sleep is very critically important and very much underappreciated. So I want you today to know how important this is for you. I want you to evaluate your own sleep patterns, and I want to give you some tips on what you can do to make it better. Why do we want to sleep? What's the importance of sleep? Well, sleep improves immune functioning. It improves our own immune status and our ability to fight off infections, to be resistant and resilient. It improves both declarative and procedural memory in our brain. Declarative memory is memory of facts and factoids that you've learned in your brain that you have to recall. Procedural memory is skill sets and how to do things. That type of memory is improved with sleep. It decreases the inflammatory response, and I will tell you that inflammation is the bad guy. The more things we have in our bodies that create inflammation or allow inflammation to persist, those things increase aging processes. They increase our risk of cancer. They increase our risk of dementia and brain deterioration and overall cellular aging. So everything we can do that decreases inflammation and the inflammatory response in a chronic basis is a good thing to do. Sleep is one of the key things to maximize that benefit. Sleep improves healing. We find not only do we heal faster from injuries, but we also heal faster from infections. So systemic healing from bacterial or environmental infections like viruses, common colds. Studies have shown that people who sleep well fight these things off better. And athletic studies show that people who have injuries heal better from their injuries. They return back to full functioning, back on the gridiron as fast as they can when they're sleeping well. Most people don't appreciate the importance of restoring hormones. Everything in our brains and everything physiologically that we do is balanced by neurotransmitters. If we've got the right neurotransmitters affecting the right receptor sites at the right time, in the right balance and proportion, then our brain functions as efficiently as it can, and that controls everything else in our body that goes from there. If we don't have the right amount of hormones, if we don't have the ability to replenish and restore hormones, if the neurotransmitters are not working well, then our brain function and everything else, the ripple effect of that is devastating. Body composition is important, and obviously for sleep. We find out, and we'll tell you more about this later, but if you don't sleep well, then the ghrelin and leptin, the two hormones that regulate appetite and satiety, are distorted, and we gain weight when we're not sleeping well. So weight loss is very important to understand if we're going to have a weight loss program that we have to sleep well. People who are not sleeping well have a tremendous difficult time losing weight. Sleep improves reaction time, it improves cognitive speed, and it improves working memory. All these things are brain functioning, very important. The other things, it decreases our resting blood pressure, and it also can decrease our work blood pressure. So the blood pressure that we have that increases naturally when we do activities, that can be less if we've slept well. It decreases our pain tolerance, not our pain tolerance, but it decreases our pain perception, the ability of us to feel pain is increased when we're lacking in proper sleep. It increases creativity. Studies have clearly shown that people are most creative when they've been well rested. Our ability to what we call do emotional categorization. One of the very interesting things about sleep deprivation is it prevents proper emotional categorization, meaning it doesn't allow us to recognize what our true emotions are and what the meanings of our emotions are. And we get everything in our life out of perspective, especially as it relates to relationships and other things in our life that affect us emotionally when we're not sleeping well. So sleep is very important to maximize our ability to understand our emotions, to categorize what things mean in our life and put them in proper perspective and not to overreact to life itself. And then happiness, interestingly, with romantic relations have been shown to improve with people who sleep well. So for all these reasons, we want to learn how to sleep properly. In 1917, Dr. von Economo coined the term encephalitis lethargica. And what he found was that when people were prevented from sleeping on a continued basis, they had all kinds of physiologic negative effects, and eventually they died. And familial fatal insomnia was the word that he was using to talk about people who died from improper lack of sleep. But there's all kinds of also other complications here that you see, from psychological effects to blood pressure effects to heart disease, obesity. All those things are ripple effects of not sleeping well. So when we don't sleep well, it can be catastrophic. In animal models, mouse and rat studies have shown when you prevent sleep within 7 to 10 days, totally prevent sleep, those animals will die. That's the result of not sleeping well, even in the animal models. That's parlayed into what happens with us as well. Other long-term effects of not sleeping well, things like type 2 diabetes are made worse. Our insulin resistance is greater. Our insulin sensitivity, the cell's ability to use insulin and store carbohydrates appropriately, decreased when we're not sleeping well. We have increased cardiovascular disease. We have more sleep apnea, chronic inflammation, as we talked about, but things like stroke, neurological decline, mild cognitive impairment, PTSD impacts, and executive functioning. All those things are made worse when we're not sleeping well. And then we see all kinds of things with just brain function, with dementia, depression, irritability, concentration problems. Suicide risk is interestingly increased. Depression is increased, and that leads often to suicidal ideation. And Madigan did a wonderful study a number of years ago looking at people who did not sleep well on a regular chronic basis. And he found out that 23% of those people who didn't sleep well had depression, 17% had increased anxiety, 13% claimed they had symptoms of PTSD, and 25% ended up on opiates just to handle the pain that they were feeling because of the increased pain recognition because of lack of sleep. So lots of long-term effects that affect everybody when we're not sleeping well. When we're looking at the athletic realm, we see lots of negative effects on performance. We see decreased overall athleticism, the ability to be athletic on the field, increased injury risk and incidences of injuries. Interestingly, increased use of substances. So alcohol, opiates, and stimulant addiction is much more common with athletes who are sleep deprived chronically. And then significantly decreased neurocognitive performance, just our overall executive functioning of our brain is significantly less when we're not sleeping well. When we sleep only 6 hours, for example, for 11 nights in a row, that has the same cognitive effects as one night of not sleeping at all and how we're going to feel and operate the next day. So it's a very significant problem and a very significant thing that we see. One thing that's not as appreciated is what are the long-term effects of sleep deprivation on family relationships. We know now from studies that family relationship dysfunction is increased when anybody in the family is not sleeping well. People who don't sleep well, interestingly, have a lack of ability to perceive affection. One night of missed sleep makes people perceive that their spouse, their family, their kids like them a lot less the next day. Pretty interesting thing, but our ability to perceive how other people feel about us is impaired by lack of quality sleep. It's no surprise then that divorce rates, spousal abuse rates, and child abuse rates are all increased statistically with studies that have looked at people that don't sleep well and have chronic sleep deprivation. So this is a major effect that affects everything in our lives and everything that's significant. When we look at performance, we see 18 hours of wakefulness, meaning sleeping only 6 hours at night, is the same in its effect for us as a blood alcohol level of 0.05%. Not a good thing. It's interesting that 19 to 24-year-olds are 4 times more likely to be involved in a fatal fatigue-related motor vehicle accident than an alcohol-related fatal motor vehicle accident. And interestingly, 56% of men and 43% of women report driving drowsy, not just occasionally, but on a regular basis. So one thing you don't want to be is on the road at 2 a.m, out there on the road with all kinds of people who are sleep deprived. One night of decreased sleep decreases libido. So oftentimes people come in complaining of, I want to get my testosterone checked. I got to maybe take some extra testosterone. They don't need extra testosterone. They need better sleep, because sleep enhances normal hormone replenishment, normal testosterone. One of the first things we can do for people that feel tired, they don't have great libido, ability to work out well, they're afraid of low hormones. If they increase their sleep on a regular basis, they naturally enhance their normally recurring hormones, especially testosterone and estrogen balance. Interestingly, when somebody doesn't sleep well, they only perceive that lack of sleep effect for the first night primarily. So if they sleep poorly one night, the next day they'll, say, I don't feel as good, I'm pretty tired. The next night, they don't sleep the same way. The next day, they'll say, well, I'm a little tired, but I'm okay. And by the third night of sleep deprivation, they say, you know what? I feel fine. I'm doing great. So the sleep deprivation impairment, it's only observed for 2 to 3 days accurately. And after that, our own ability to understand how much we're missing sleep is way significantly decreased. This is an interesting factoid here. Loss of 2 hours of sleep increases daytime hunger the next day by 25%. So the fact of that is that if you miss 2 hours sleep tonight, if you need 8 hours and you only get 6, tomorrow on average, you're going to eat 25% more calories just because your hunger drive is increased. So people that are trying to lose weight, one of the first things we have them do is learn how to sleep well and correct that if they're not sleeping well, because it's really hard to lose weight if you're sleep deprived. Loss of 1 hour per night in terms of weight gain is 14.3 pounds of fat in the next 12 months. So it's a significant effect physiologically. Sleep is required for procedural memory, learning how to do things and how to remember how to do things and not make mistakes in following procedures or skill sets. It's required, as I talked about, for emotional categorization, which is very important. What's important to understand is that there is no active mechanism to turn sleep on. Sleep is a naturally occurring thing. We sleep primarily because of the absence of things that wake us up. So there's 2 controllers that affect sleep. One is clock-dependent alerting. So if you wake every morning because an alarm clock goes off, that sets your biological clock. If you don't have that alarm clock, then it's the normal circadian rhythm that tends to regulate whether we feel sleepy, what time to go to bed, how well we sleep, and when we wake up. So what we have to learn is that there is a natural circadian rhythm, and the more we can emphasize the regularity of that rhythm, the better that we're going to sleep. So if you look at just overall cortisol levels, you can see this graph here where cortisol levels are increased around noon. At 8 p.m., they start to go down, 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 6 p.m., 8 p.m. At 12 in the morning, they're the very lowest. And then at 6 in the morning, 7, 8 in the morning, they tend to be their highest. So when cortisol levels are their highest, it's when we're trying to wake up. It's nature's own way of trying to allow us to be alert, to be organized, to have our brain wake up and be able to do cognitive functioning. And then it gradually goes down the rest of the day until about midnight again, when it starts to be at its low. So normal adrenaline regulation is regulated by circadian rhythms. When we sleep, our biorhythms of sleep are very much the same. turns out that we have sleep cycles, and about every 90 minutes, we cycle through all the various stages of sleep. If you look at this graph will tell you what our sleep stages are. Stage 1 of sleep is very light sleep. It's where we're not even really asleep totally. We're aware of our environment, but we're not interacting with our environment. Our activity slows down. There's occasional muscle twitching. Sometimes people feel like that as they're starting to go more and more into sleep. And then stage 2 sleep, which is 45 to 55% of our total sleep, the breathing pattern changes, the heart rate slows down. We have a decrease in body temperature. That's one of the reasons why it's better to cool the ambient temperature down if we want to sleep well, because our body temperature naturally falls down. And then stage 3 sleep, which is not much of our sleep, only 4 to 6%. It's the start of deep sleep. And our brain begins to generate very slow, what's called delta waves. And if you look at the top here, you can see the difference in brain wave activity for each one of these stages of sleep. So when we do sleep studies, we can tell you what phase of sleep you're in just based on looking at your brain waves. Stage 4 sleep is very deep sleep. So 3 and 4 are progressively more deep sleep. That's very rhythmical breathing, very limited muscle activity. And we have delta waves that are wider waves that you see. And those are very, very important for brain restoration. And then stage 5 is the REM sleep, the rapid eye movement sleep. That's where our brain becomes very active. Total sleep in REM is about 20 to 25%, depending on the person. That's where dreaming occurs because our brain is very active. Our muscles are totally relaxed. Our muscles basically are paralyzed. We're not moving at all. And our heart rate increases. Our breathing is rapid and shallow, and our brain waves are quite different. So that's the cycles of sleep, and we tend to rapidly go through those things, or I should regularly go through those things, about every 90 minutes. It's different for each person genetically, but on average, we cycle through that a number of times. And many people say, as an example, I just feel fine on 5-6 hours sleep a night. I don't need more sleep than that. Well, I'll tell you what, people that think they're doing fine on less than 7 hours sleep at night, when we measure their sleep activity, we measure their hormones, we measure their brain activity, their memory, their cognitive abilities. They're decreased in their abilities when they're not sleeping well, even though they think they're functioning fine. And if you look at this, this gives you a clue as to why. The REM sleep here, this first phase of REM sleep may only last 10 minutes, but every progressive next phase of REM sleep is longer, longer, longer. The final stage of REM sleep here may be up to an hour. So if you miss the last cycle of REM sleep, you're missing the most restorative part of REM sleep in the entire night cycle. And you can see that the deep sleep primarily is in the early part of sleep, and the REM sleep is in the greater part of sleep. So all these things are naturally occurring for us, and unless we allow ourselves to do normal sleep and have normal sleep architecture with normal brain wave cycling, then we're not going to be fully restored and rested in the morning, even though we may be not awake. So you can see here, this is again an example of stage 1, 2, 3, 4, and then back up to REM sleep, starting with maybe 5 minutes of REM and 30 to 60 minutes of REM later in the evening, and then we finally wake up. So what's interesting is that in stage 1 sleep, that stage where we're almost not asleep, we're aware of our surroundings, but we're not interacting, we're not speaking, but we are aware of our surroundings, that's when we're easily awakened. So if there are things in the environment that are stimulatory, like dogs or cats moving on the bed, or the room being too warm, or if you have to pee and your pressure from the bladder is high, somebody's coughing in the room, you hear a noise or a light, anything like that that is stimulatory, when you phase back up to stage 1 sleep, that can wake you up, and that can be very hard to get back to sleep. So when we're looking at sleep patterns, we have to understand that we have to cooperate with the whole environment as much as we can. And there's ways that we can design that, and we'll talk about that. So we are designed by our natural endocrine system to sleep well. So everything is designed to help us be appropriate. When blue light decreases, blue light is full spectrum light. So that's the sun. When the sunlight goes down naturally, that stimulates the pineal gland in our brain. It's a very small gland in our brain to release melatonin. And melatonin is the natural neurotransmitter that triggers restfulness and eventual sleep. When we have appropriately triggered melatonin, that decreases our adrenal function. So that's why one of those things that causes the cortisol to go down, because our adrenal cortical function goes down. Because adrenal function decreases, our body temperature decreases, our heart rate decreases, our blood pressure decreases, our brain waves slow down, just like we talked about. The blood sugar drops, so our glucose utilization drops. Our immune system is increased. And all those things are dependent, each one, on the thing before it happening. And if one of those things doesn't happen properly during that cycle, we're going to have impaired sleep. And finally, our hormones are replenished. So we think, well, when we're sleeping, not much is happening. That's not true. When we're sleeping, our hormones are totally, especially growth hormone is being replenished. Our testosterone is being replenished. All of our sexual hormones are being replenished. Our neurotransmitters are being replenished. All those things happen when we sleep. So physiologically, what happens in this pathway is tryptophan turns into hydroxytryptophan, which produces serotonin, which supports melatonin, which lowers adrenal function. So that's the physiologic pathway that's naturally occurring without us having to do anything. Our bodies just do that for ourselves. And number two, the 5-HTP turning into serotonin and supporting that, and then melatonin, all that requires vitamin D3 and magnesium. So when we look for why people are not sleeping well, sometimes we have to appropriate all these things to see whether or not you are performing them as you should. And if you're low on vitamin D3 or you're low on magnesium, you're not going to have the ability to have all these physiologic effects occurring naturally for you. So that's one of the reasons we check vitamin D and magnesium to see if that's low for you. If you need to supplement that, that can actually improve sleep. And many people, when they don't sleep well, they go, I know what it is. I know it's my thyroid, right? There's lots of reasons why people may not sleep well. And if you look at these basic 5 things, these are the categories that cause sleep problems. You can have medical conditions like asthma or COPD or congestive heart failure, diabetes, allergies, all these different things biologically can hinder sleep. You can also have psychological disorders, including depression and anxiety primarily, that prevent sleep. You can have basic sleep disorders such as obstructive sleep apnea, which we'll talk a little bit about in a minute. You can have central sleep apnea. You can have restless leg syndrome. You can have pharmacological agents. Many drugs affect sleep, and most people don't appreciate how many drugs there are that can interfere with and affect sleep, especially if you look at the bottom there, nicotine, alcohol, those things affect sleep adversely. And selective serotonin reuptake inhibitors, SSRIs, those are mental stability drugs that many people take for depression. Those things can affect sleep. And then we can have environmental factors such as what's the temperature, what's the light in the room, what's the noise going on, how much does your bed allow you to sleep comfortably, pets jumping up and down, mates in bed with you, all those things can affect sleep. And every one of those things can alter sleep adversely. And so when we're going to do a sleep evaluation, we really have to look at each one of those things and say, okay, where is it that you're not optimizing any of those things? And how can we fix those things when they're not working well? People ask how much sleep I need. Well, it depends on what your age is primarily. You can see that newborns need 12 to 18 hours of sleep, and then it progresses through to teenage years where you need probably 8.5 to almost 10 hours. School-age children, 5 to 10 years, up to 11 hours of sleep a night, and adults on average, 7 to 9 hours a night. I had a good talk. I was on a panel for wellness in Florida earlier in the year with a person that was there from the University of Arizona Longevity Institute. And they asked him, how many hours does the average American adult need to sleep every night? And the answer was very interesting. He said, if you sleep at night by yourself, you go to sleep without causing anything by drugging yourself to sleep, you fall asleep and you wake up in the morning without an alarm clock and you feel rested, that's probably how many hours you need. And there are some people that feel they can do fine on 5 to 6 hours, but as I've said before, most people who do that are actually, when we test them, they're not functioning well on 5 to 6 hours. But most people, when they're on vacation, if there's no stress in their life, if they're just sleeping naturally, they'll find that they need 7 to 8 to 9 hours sleep at night. There are also some studies, interestingly, that show if you sleep more than 9 hours a night, that may be a problem. Maybe it's because of depression or other things going on medically that are causing that. The average adult does need 7 to 8 hours sleep a night to optimize that sleep. If you get that on a regular basis, it's going to be the very best for you. So when we don't sleep, what happens is very interesting. We don't release growth hormone or testosterone as we normally would. Because of that, we have chronic inflammation, or in addition to that, we have chronic inflammatory markers that increase. Because of inflammation and the lack of hormones properly assessed, we don't feel like moving. And so we have less motion, we have less activity. Because of that, our metabolism slows down, we get fatter. Fat turns testosterone, interestingly, into estrogen. So when we're not exercising, the testosterone that we do have as a male gets turned into estrogen. You get fatter, your muscles shrink, and you get movies. And so that's all the negative effects for men that don't sleep well. For women, it's a similar kind of a thing, and they're not sleeping well either, and they're having the same kind of adverse physiologic and anatomical effects. So what do we do to sleep well? How do we mitigate poor sleep? The first thing is I would look at all those 5 areas we talked about before and figure out which of those things may be interfering with your sleep. There are certain things we can do to plan for proper sleeping. One is when we wake up in the morning, we get exposed to bright lights. They have for areas of the world where people don't have full spectrum light early in the morning. You look up in Alaska or Canada where the light dark cycles are quite different. Oftentimes people get depressed unless they figure out a way artificially to expose themselves to bright light early in the morning for at least 15 to 30 minutes. So one thing you can do is get out early in the day, spend at least 15 minutes in the sun, or if you don't, you can get on Amazon, you can get bright full spectrum light, artificial light things, and you can put that in your face next to it, 12 to 18 inches away, and that can help wake you up. Stimulating music or loud noises actually also help wake us up in the morning. Movement and exercise is wonderful. That's why many people find exercise being most helpful when they do it first thing in the morning. They get up, exercise wakes them up and makes them feel better. Staying hydrated all day long helps us be alert and functional well during the day and be ready for sleep at night. And not having caffeine after 2 p.m. Many people are addicted to caffeine without even realizing it. They feel like they need caffeine to be alert. They start having more caffeine, and pretty soon they're dependent on caffeine. Their brain's actually quite dependent on it and is tolerant to it. If you want to know whether you're dependent on caffeine or not, try stopping caffeine and see if you get a headache. Because if you get headaches when you stop caffeine, then that's a withdrawal symptom from your brain trying to get rid of the effects of no caffeine. We weren't made to need caffeine or caffeinated beverages to be alert, awake, to function properly, or to not fall asleep. But we've learned to be able to do that. The reality is there's probably, for most people, not a problem with 1 or 2 cups of coffee or caffeinated beverages per day, usually earlier in the day. But many people who have high blood pressure, who have arrhythmias, cardiac ectopy, we call it, they can't sleep at night, or they wake up after they go to bed without being able to go to sleep again. It's because of extra caffeination. So one of the things we do is we decrease or stop caffeine. That can really help. More mitigation. Look at all these things. Avoiding sleep aids. Sleep aids seem like a good idea, and occasionally they can be if it's just an episodic kind of a thing. But on a regular basis, when we use other artificial means medically, either hormonally or just supplement-wise, to help us sleep, then our brain adjusts to that and then eventually needs that to allow us to sleep well. So avoiding sleep aids in general is a good idea. Sleep restricting when necessary, but not all the time. Planning for optimal sleep. Again, no alcohol at least 3 hours before bedtime. Alcohol is an interesting thing. I'll talk about that again in a minute, but alcohol actually can keep us from sleeping well. So we say that sedation is not the same as sleep. Many people use alcohol to sedate themselves and help them go to sleep, but then that doesn't result in useful, normal sleep. Stopping vigorous exercise 4 hours before bedtime is a good idea. Some people say the exercise makes you sleepier. That's true. It makes you sleepier at night, but it's best to do vigorous exercise earlier in the day. It takes 3 to 4 hours from really strenuous exercise, hard exercise, for your brain neurochemistry to calm back down again and optimize itself to be ready to sleep. So easy exercise, a walk around the block, doing something very comfortable, lightweight, 60% capacity, that's okay. But not strenuous exercise within 4 hours of bedtime, especially if you have a problem getting to sleep well. About an hour before you go to bedtime, just kind of shut yourself down. Just sort of cool your engines. Don't do things that are activating. Quiet your lights, quiet the music, quiet your brain engagement. Use your bed for sleep or for sex, is what the experts say. Don't sleep if you're sleep deprived. While you're trying to sleep in bed, look at your screens. Don't look at TVs. Don't read mystery novels that are aggressive, kind of horrible things. Use your bed for relaxation things, just sleeping or sex, but avoid things that are very engaging or activating for your brain, because then your brain gets used to not expecting to sleep well because you're too cranked up. Decreasing the room temperature. Most people like the room temperature around 68 to 72 during the day, but at night, probably 60 to 66 is a better range for people to sleep comfortably. Having a hot shower or bath about an hour and a half before bed can be very effective. That helps you relax your muscles. It helps your blood pressure fall. It helps your respiratory rate go down. Those are just things that naturally help us relax. Doing muscle relaxation practice, yoga, or doing just gentle yoga, gentle stretching exercises. Those are things that relax us again, slow our heart rate, slow our blood pressure. It's a great thing to make a gratitude list. A lot of people who are stressed at night, they say, what do I do to get rid of the stress I feel at night? One of the best things they can do is write down 3 things that you're grateful for that you've been experiencing that day. And that just switches your brain to thinking things that are positive for you, not things that are problematic and cause your brain to go nuts and trying to solve problems. So focusing on gratitude late in the evening, especially right before you go to bed, or even journaling and writing down, what am I grateful for today? What was the meaning of that thing for me? And why was that important? And how did that make me feel when I experienced it? Can be a wonderful thing to start your brain getting ready to expect to sleep well and have a feeling of forgiveness and gratitude as you go to sleep. And then a patient of mine said, I've got a God box. I said, what's that? He said, well, I've got a God box. And when I'm really stressed about something at night, and I can't go to sleep, and I know I'm going to have a bad night because I'm ruminating about what that is, I just write it down, whatever that is, and I put it in this little box, and I ask God to hold that for me at night, and then they'll give it back to me in the morning. So having a God box to just write down things that you're worried about, knowing that you can come back to in the morning. You don't have to deal with them at night when you're sleeping. They'll wait for you. They'll still be there for you in the morning. And then allow yourself to relax. Very, very important. So alcohol and sleep. I want to just say a word especially about that because people don't appreciate it. Lots of people use alcohol to allow themselves to relax, thinking that's going to help them sleep better. And it does actually have a different effect. It decreases restful sleep and it decreases REM sleep. Alcohol disrupts the normal sleep architecture. So when we look at those normal variations in sleep cycles every 90 minutes, alcohol doesn't allow that to happen. It induces sleep, so it sort of drugs you by making you tired, but then you fall asleep, and within 1 to 2 hours later, there's actually a stimulatory effect. What happens is when the blood alcohol level falls below a certain threshold, there's a stimulatory effect where your brain wakes itself up. It causes adrenaline, and then you wake up, and then you can't go back to sleep. So it's interestingly how many people tell me when I've stopped alcohol, I can't tell you, doctor, how much better I slept. And one of the first things that sleep experts tell people in sleep study clinics is if you're having trouble sleeping and you drink on a regular basis, stop drinking alcohol at night and see how much better your sleep gets. And most people find it really does help their sleep. So I recommend if you're having trouble and you drink regularly to try a trial just for a week or 2 weeks of no alcohol at all and then retrospectively figure out, is that helpful? Did it really make a difference for me? Because remember that sedation is not the same as sleep. And what alcohol does is it causes artificial sedation, but that's not normal sleep architecture and sleep waves. What are 10 things you can do to help perfect your sleep? Blacken your room. And I'll just tell you the thing that really impressed me about this. I had a doctor working with me who is the head Navy SEAL team doctor at Coronado. And he'd been a Navy SEAL himself. Then he went to medical school. He became a doctor, specialized in undersea medicine. And then he specialized in helping out the SEALs. He became the head SEAL team doctor for Navy SEAL teams in Coronado, most of whom have trouble sleeping. A lot of them have chronic pain. They've got sleep-wake cycles that are totally abnormal. They sleep when they're in the day. They try and stay awake when they're working at night, when it's dark. And he's got plenty of SEALs who had sleep insomnia for 6 to 12 months, even longer than that, never having had a good night's sleep. So he took a group of SEALs who were all insomniacs. They hadn't had a good night's sleep on the average at least the last 6 months. And the very first night, they put them in a black box closed container environment. Zero sound, zero with, total buffers in all the walls and the ceilings and the floor, so they couldn't have any sound penetration at all. Blackout curtains, they had no lights at all, no LED lights, nothing. So total blackened room. They had no electronics, they had no light, they had no stimulation at all. And when the average SEAL who hadn't slept for 6 months was put in that environment, they slept on average for 10 hours the first night, 10 hours sleep. So that was just because they were no longer stimulated by things that were waking them up. Don't use electronics in bed. Make a consistent bedtime and stick to it, because when you go to bed at a certain time, your body will gradually get that cycle going where you're sleeping for the right amount of time. We also try to have you get up at the same time every day, because that's, some people feel, even more important than going to bed at the right time. If you get up at the same time every day, that sets your biological clock to feel tired about 16 hours or 12 hours, whatever it is that you're going to need later on. So when you get up at the same time each morning, it sets your biological clock to have the same sleep time at night. That can be very helpful. Practice stress reduction. Be aware of, this is emotional categorization. Be aware when you're at increased stress. A lot of people, I don't have any stress. Well, a lot of them they do, and they don't really appreciate it. So think about, what are the ways that you do have stress in your life, and what are 5 ways, whether it's exercise, whether it's eating right, sleeping better, writing down a journal, talk therapy, whatever it is that you can do to decrease stress. Practice that on a regular basis. That'll help you sleep better. I would say the majority of my patients that are not sleeping well have unresolved stress that they're dealing with subconsciously at night when they can't shut their brain off. So being aware of stress and dealing with it, very important. Improve your insulin sensitivity via diet. And the way we improve our sensitivity to insulin and the ability of insulin secreted by our own pancreas to control glucose in our brain and decrease inflammation is by decreasing simple carbohydrates. When we decrease simple carbohydrates, our insulin becomes more productive, it's more active, we're more sensitive to it. Our hemoglobin A1C, which is the average measure of our blood sugar over the last 90 days, goes down. And interestingly, we were able to lose weight much better. So learning how to eat properly, mainly it's not late night eating. Mainly it's getting rid of nutritionless calories, which are primarily saturated fat and simple carbohydrates. And simple carbs are the white things: white bread, white pasta, white rice, anything with added sugars, sweets, and alcohol. Those are the things that have no nutritional value, but decrease our insulin sensitivity and increase inflammation in our bodies. Exercising on a very, very regular basis. They took a group of people that were, again, insomniacs. The only thing that they did for this entire cohort for 6 weeks, they didn't change a thing about their lifestyle, except they gave them every day for 6 weeks 45 minutes of vigorous exercise. And those people who got 45 minutes of vigorous exercise on a daily basis for 6 weeks, at the end of that time, their average time to fall asleep was 50% as long as it was before, and their average time spent actually sleeping was a full hour more. So exercise has a wonderful effect, a responsive effect afterwards to increase our sleep. It increases our relaxation ability and increases the quality of our sleep at night. So vigorous aerobic activity, not always just strength training. Strength training is fine, but it's aerobic activity that really tends to set our biological clocks to sleep better at night. So I encourage you to do that on a regular basis. Decrease blue light therapy 3 hours before bed. That's full spectrum light. So dampen the lights down. Don't have bright lights. Cognitive behavioral therapy, CBT, that's called. It's reframing the experience. Many people don't sleep well because they convince themselves they're not going to sleep well because, we're all habits of yesterday. I didn't sleep well last night, so I'm not going to sleep well tonight. Or I've had to deal with something tough today, or I've got something tomorrow. I know it's going to be stressful for me. I know I'm going to be worried about that tonight, so I'm not going to sleep well. Well, all you've done is you've programmed your own brain to not sleep well. So learning how to reframe the experience of tonight, I'm going to have a great night's sleep. I'm going to give myself permission to relax. I'm not going to worry about other things, and I'm going to sleep well, and I'm going to be glad I did in the morning because I'm going to wake up really feeling rested. Very, very important how much our brain can control expectation does breed reality, and we can learn to change our expectation, reframe the experience, and inform us basically the placebo effect that we give to ourselves. We are the placebo, and that placebo effect can help us sleep better. If you're not sleeping well and all these things are already taken into account, consider getting a sleep study, especially if you snore. People that snore, maybe you don't know that you snore, but somebody you sleep with hears you snore, and they tell you, hey, you do too, snore. If you snore, you may have interference with sleep. You may not be sleeping as well as you should, and a sleep study can be very helpful for that. So this is just an overall clock kind of a thing of all the things that we can do to help ourselves sleep better. Develop a goal of getting to sleep in a regular ritual. I'm going to sleep at a certain time of night. Sleep in silence and in the dark. Don't eat much before going to sleep. Big meals late at night, one of the biggest causes of not sleeping well because our body is trying to digest food as opposed to allowing us to sleep. Not smoking at all is a good idea, and not using alcohol can help sleep a lot, as we just talked about. Doing something gently active before bedtime, like taking a walk, can be beneficial. Giving up caffeine after 2 o'clock in the daytime, good idea. Sleeping on a firm level and a comfortable bed. Some people just sleep better because they didn't have a good bed before. So check out how comfortable a bed is, how appropriate is it for you. Some people like a soft bed, some people like a firm mattress, but whatever it is that you sleep best on, figure that out. Figure out what time and temperature you sleep best at. Most people, if you dampen the temperature 5 to 7 to 8 degrees at night compared to what you are during the day, that's going to help you sleep better. Going to bed, waking up at the same time. Don't working, especially on electrical appliances near your bed. That just makes you think about, I got to check my cell phone, I got to check my whatever it is. But get rid of those screens in bed. That's not a good idea. Don't watch TV, especially murder mysteries, right before you want to go to bed. And don't focus on insomnia. Focus on gratitude. Don't count sheep, count blessings. That's the critical thing. Napping, people often have asked, how does that matter? Well, napping is okay if you're sleeping okay. Naps are actually a healthy thing if you're not using a nap instead of sleeping well at night. So napping during the day for a short period of time doesn't interfere with sleep, studies show. Early afternoon is probably the best time for a short nap, and 30 minutes max. 15 to 30 minutes is sort of the max time for sleep. If you sleep longer than 30 minutes, you can get more into that deep sleep state, and then it's hard to wake up and you feel groggy for a long time afterwards. So short naps are good. Setting the room temperature comfortably, that helps with that. After 3 p.m. may interfere with nighttime sleep. So I do recommend, if you sleep with a nap a little bit, that you do it earlier in the day, and you don't do it as a substitute for sleeping at night, just as a beneficial kind of a thing. People ask, well, what about supplements? And there are some supplements that are reputed to be safe, but remember that anything you use to alternately affect your brain to help you sleep is not natural. And the more you can do it naturally, the better it is. And I'm going to be very interested. Dr. Moyad is one of the world's experts on supplements. I'm going to be very interested in what he has to say about these safe supplements like valerian root, chamomile, melatonin, and passion flower. Those are things that are often in benign over-the-counter sleep aids. There's another one that's often listed, and that's all the PM drugs. The PM have basically it's a diphenhydramine, which is like Benadryl. That's the brand name that most people know. It's a Tylenol PM, Advil PM. They have diphenhydramine in them. That's an antihistamine that causes sedation. So sedation is a side effect of that, but it has a longer half-life and can cause a hangover effect in the morning. So be very careful of getting sleep regularly because of those PM drugs. They can be a problem. There are brand names like Insomnital. I'm not advertising that one, but that's just an example of a drug that has some of these quote safe supplements in them that may not be negative. A gamma aminobutyric acid, it's a naturally occurring neurotransmitter that alcohol is involved with. And that may be a safer drug. It's using now a lot. Gabapentin is used for pain relief for a lot of people. Some sleep experts are using it for sleep, but that's something that really ought to be used under doctor's prescription. And anything you do on a regular basis, again, what happens is when you take something in that sets up increased potency to your brain has to adjust to that. And when it has to adjust to it on a regular basis, your brain changes what it naturally does to accommodate that thing you're taking in. So for example, if you take melatonin in every night, your pineal gland in your brain says, hey, I don't need to make as much melatonin myself because I'm getting it exogenously. I'm getting it from an outside source. I'll just stop producing it. And then when you stop taking melatonin to sleep, your brain isn't producing it on its own, and now you can't sleep at all. So be aware of dependence that can come from sleeping with those kind of things. Sedative hypnotics, like the other drugs like Ambien, et cetera, typically can have a hangover effect. They can affect memory. They can affect during the day attention. They cause physiological and psychological dependence. The psychological dependence on those things can be very, very significant. There are some of those drugs that cause hallucinations at night. They even can cause suicidal ideation. There are concerns. Some of the more recent studies have shown that people who sleep regularly with hypnotic drugs have greater mild cognitive impairment as they age, and they get more dementia potentially. So that's a concern we have. Some of these drugs actually separate out the front brain from the midbrain. They knock you out, so they're sedative, but the whole brain is not in connection. It's not working. And so that's where we get, sometimes people get up at night, they sleepwalk. They can actually do physical things like driving their car, like going down to the store, like cleaning out the refrigerator and not remembering any of it in the morning. And they're called parasomnias. Those can occur because of sleep drugs that inhibit your brain from working naturally. Alcohol can cause respiratory depression, even respiratory arrest in people who have either congestive failure or pulmonary problems. And sedative hypnotics can be linked to all these medical things like heart disease, cancer, depression, anxiety, et cetera, and even all-cause mortality, which is interesting. There are some newer drugs on the horizon. Rozerem is one that just helps melatonin work a little bit better theoretically. Belsomra is one that's called an orexin receptor antagonist. Orexin is the receptor site that when it's stimulated, it wakes you up. So rather than having drugs that try and put you to sleep, this one helps block the thing that makes you wake up. But those are all relatively new drugs. I think they can all be abused. They're reputed not to be as addictive, but I wouldn't recommend using any of those things without checking with your own doctor, making sure that you need them, using them for the shortest period of time, the least possible dose. A word about sleep apnea to close. Sleep apnea is a breathing-related disorder. It's involved in repetitive pauses in breathing, where you're not breathing rhythmically. You've got areas of your night where you stop breathing. And it can be periods also of just shallow breathing where you're not getting deep inspirational breaths that really aerate your lungs and your heart and your brain. It can be involved with snorting or choking sounds. Spouses often say, yeah, my husband or my wife has these funny sounds they make at night after a period of not breathing at all. And it can result in snoring and daytime sleepiness. When we sleep with abnormal breathing, we don't have restorative sleep. We're less alert during the daytime. That causes increased inflammation. I've already told you, inflammation is the bad guy. And it decreases immune function and multiple negative physiologic and brain effects. So if you're concerned about sleep apnea, I would get a test. There are tests for it. There are home tests. There are sleep study places where you have to go in and get a test sleeping in like a strip mall, and they wire you up with everything. I'll talk about that in just a second. To prevent sleep apnea, it's interesting how many people have sleep apnea that just totally get rid of it by weight loss, by exercise, stopping alcohol, dealing with stress, and avoiding late night eating. So sleep apnea is not often something that you're just concerned with for the rest of your life. It's things that are lifestyle created, and lifestyle can help prevent those things as well. If you want a sleep study, the formal sleep lab is where they just wire you up and you sleep in an artificial bed in a totally closed, like that seal type environment where there's no light, no sound, nothing, and they measure everything. Home sleep studies now have been done. They're very, very good. They give you wearables. You can do about 90% of all the information acquisition with a home sleep study that you used to have to do at a formal sleep lab. So it's very easy to do now. They'll send you the stuff in a box and you hook yourself up and you turn it in the next morning, and it's a pretty good deal. It measures brain waves. It measures your blood pressure. You can measure heart rate, measure respiratory rate, how many episodes you have where you're not breathing and how long those are. It measures body movement, like restless leg syndrome, how much movement you have. It interestingly measures what position you're sleeping in, how much of your sleep is on your side, on your back, on your stomach, and it measures obviously the sleep stages. So looking at all that, they can figure out what your overall sleep architecture is in a sleep study. And based on that, we can figure out where we need to intervene to help you sleep in a more effective way. There are also some novel remedies to help people sleep. One is called the Inspire procedure, where there's a little wire inserted in your mouth that actually stimulates the muscle that keeps your airway open. And so the ENT doctor that was, they trained at Mayo Clinic, is doing that here in San Diego, says it's probably 85% effective at people who have obstructive sleep apnea, preventing them from needing to be on CPAP, which is very interesting. CPAP is a very good device which causes positive pressure and keeps the airway open. And many people just sleep tremendously better with CPAP, but it can be cumbersome and it's harder to live with that kind of apparatus on you. They have made a smaller device now, though, for CPAP that actually is for travel. So it's not as big of a deal to travel with that mechanics, but it can be helpful to use that CPAP in many ways. It just saves people's lives, literally. But the Inspire procedure is something that may prevent you from needing that. They're making newer and more effective oral devices that you wear that just sort of maintains a more open airway. The nasal strips probably are not that effective for most people, but they can be used. And then there's a new bit of evidence with transcranial magnetic stimulation, TMS we call it, where people get treated with stimulatory things in their brain. It basically, I think, helps them deal with stress better. And because they're dealing with stress better, they're more relaxed at night, and then they can sleep better. So that has to do with depression. People that are very depressed, it's been FDA approved for depression. And if depression is increasing lack of sleep, then that's one thing that can help that. So there are some resources I'm give you here. If you're interested in looking at some of those resources, they're very good at just giving you more up-to-date information and any way that you can get information on a regular basis, because this is a rapidly growing field. Lots of new information coming about on a regular basis. Happy to give it to you. And my recommendation is to stay up to date on what's possible, understand what's happening for you. And if you need help, please get help, because sleep deprivation is something that's way underappreciated and can destroy not only the quality of your life, but increase many, many disease states that are going to bite you in the end. So Thanks for listening. Hope this is helpful. And Dr. Moyad would be happy to answer any questions.
Standing ovation. Hold on a second. I'm going to standing ovation. Ooh, my knee hurts today. I went running this morning like you, and I kind of overdid it. And part of the reason is I got so excited that my brother from another mother, Dr. Lee Rice, I call him Instant Rice. Do you know why I call you Instant Rice?
I have no idea.
Because you're fast in giving an answer. So whenever you and I are talking about a consult or something like that, where nobody is seeing our phone call, if I have an answer and I need an answer quickly, you give it to me quickly. So I call you Lee Instant Rice. What do you think about that?
Uh, I'll go for it. I
You don't seem
appreciate it. I'll take it as a compliment.
Okay, so I've known Dr. Rice maybe 20 years, 20 years, 15 to 20 years. He's a very humble man. He still has a very big, busy practice. It's an amazing practice that sees all sorts of conditions. I couldn't think of anyone else better to talk about sleep. I also recommend to people they look at the previous lecture that he gave a year or two ago on addiction. And if you look around the internet, it's not easy to find an objective, in my opinion, lecture on addiction, types of addiction, what to do about addiction. I actually watched that one over again about 6 months ago. That was awesome. So he's already done one for us, and his background is amazing. Not only has he done this for how long have you been in practice? You've been in practice 40, 50 years, right?
Something like that.
I mean, that's incredible. That's an amazing amount of knowledge. You're like an AI guy. Like just your brain's got so much in there. You're sort of an AI person. And then you used to be the personal physician, or actually the physician to the San Diego Chargers.
Right.
And
16 years.
how, 16 years?
Yeah.
How was that experience? Did you get to travel with the team?
Yeah. Yeah. It was a great experience. One of my more fun experiences in life. I've been fortunate to be involved with a lot of teams, but that's been one of the most interesting and exciting things that I've done because I love football, and it's been a great time to be just the networking of wonderful people you get to deal with and the things you get to be associated with. It's a real blessing.
That's really amazing. And you still do some work with the NFL now, don't you?
I do now. I do work with the NFL Alumni Association. There's a nonprofit called NFL Alumni Health, and we're trying to use NFL veterans who are icons in their communities to take messages of wellness back to their communities and elevate the level of health in the communities that they come from, often communities of color, communities that are not as well-to-do and well as educated as other communities. And the average person in those communities can die up to 10 years before average communities. And so all we can do to improve the education and the access to healthcare and the ability to access healthcare resources, very, very worthwhile.
That's like your 28th job working with the NFL. Every time I talk to you, you're in some other country. You also do some work with the Olympics, right?
I'm the chief medical commissioner for the International Surfing Association. So I'm in charge of the international surfing for the Olympic, like Tokyo and the recent one in Paris, which was actually Tahiti, and upcoming in the LA Olympics. I'm in charge of the organization of the medical care for those events.
And you have a busy medical practice in San Diego.
Right.
So if people want to see you for any of the conditions you see, we have it. I think we have your website that will be listed. So you're still seeing patients most days of the week. Is that right?
I am.
Okay. So let me ask you a softball question. Who's your best friend in the medical world?
Oh, it's you.
That's a good answer. That's the answer that you got right. So, all right, you've just humbled me with all the stuff that you do and how busy you are. And I have to tell you from behind the scenes, you know how I don't like to give too many compliments because then I think it makes the cranium too large, and then suddenly that doctor or person can't walk out of the door. There's not only did I just reveal all the other stuff that Dr. Rice does. Dr. Rice is one of the few doctors that I talk to on a regular basis, or we talk back and forth and trade stories and education, that the man practices what he preaches. There's not many people like that. I tend to bring up the names of those individuals. So all the things that he talked about today, the things of being healthy, the lifestyle changes, he's the one guy I can relate to. In fact, when we talked this morning, I said, I'm going for a run. He said, I'm going for a run. You've always not only been kind and great and brilliant, but you've always practiced what you preach because you have a lot of preaching to do. And what I find behind the scenes is that a number of people will not practice what they preach, and that just makes me absolutely wacky. I just, it's just go do this, listen to what I say, not what I do. Anyway, I wanted to throw that out. All right. I want to show you pictures of what it looks like to get really great sleep through one of my family members before we start. Can I do that?
Go for it.
All
Yeah.
right. The great Peter Scholes, the technology mind, one of the minds behind the scenes he's going to bring up. And I want you to comment after you see a couple of these photos, if he can bring them up. That's not me. That's my dog, Grazi. Do we have another shot of him sleeping? Look at that. Look at the position, Dr. Rice. Look at that. Do we have another one there? I want to look at that. Do you have any critique, Dr. Rice, for my dog who just
I think that's a great sleeping position. It's not on the back. It's sleeping nice, comfortable cushioning. I think the ergonomics are excellent, and I think that dog's going to wake up feeling rested.
Okay, we can cut. Oh, I forgot. This is my balcony.
Now
This is
that
the
dog
one he
died. You should get a different dog.
My friend texted me that. He said, "Is the dog alive?" I said, "Of course he's alive." And I said, "This breaks Dr. Rice's rule. Like you're supposed to sleep in a dark room. This is
Yeah.
out bright sun on the balcony. It keeps him warm." And so this is the life of a dog at the Moyad house. And so do we have any others that Dr. Rice can critique or not critique? Or did that the last one? Brilliant, isn't it? The dog's 5. Oh, okay. So there you go. You're right. So this is after the dog went to sleep. You said he was in the right position.
All right.
Okay. So he wasn't just on his back. He was more on his side. And so he was great. All right. Thank you for doing that. I appreciate it. I didn't think about that sleep position. That is true. It's amazing how sleep position, and we'll go back to sleep, but this is, how I'm tangential. It's amazing how sleep position changes sometimes your health, whether it's for sleeping on your left-hand side for acid reflux. I've heard that, for the position of the stomach. But can you just comment on that again briefly, why you said that about my dog?
Well, there's a couple of things about positioning. One is, especially as people get older, they often have infirmities. They have neck pain, or they have a shoulder problem, or this or that. Their back hurts. And if they don't get into a good ergonomic posture when they're sleeping, they're awakened by pain. And some people can sleep on their side, but they've got shoulder bursitis. And so if they lay on their side, or maybe they've got hip bursitis, and every time they sleep on their right side, their hip bursa wakes them up because of the pain, the swelling in it, and they have to turn over, and they're constantly doing that. Or if people have urinary problems, and some positions make you more aware of that. And so most people find that they sleep better, more soundly, if they're either sleeping on their stomach or angled. I have people use lots of pillows so they can sort of orchestrate their sleep. They're not just directly on their stomach, they're a little bit angled on their side, one way or the other. On the back is probably the least helpful for people as they age, because they tend to snore more on their back. The soft palate collapses down, the airway becomes smaller as the muscles relax, and then they wake up because they're not sleeping well. So side or stomach sleeping tends to be back best. But many people also have reflux, GERD, we call it, gastroesophageal reflux disease. And for people who have GERD, it's important to have the stomach be higher than the waist, because otherwise, if you've got a little hiatal hernia, allowing reflux to come back, anything that by gravity increases the reflux back upstream can irritate your esophagus. And one person, very interesting story, but it sort of elucidates this, complained of hoarseness, and I sent him to the ENT doc because of hoarseness. He had no reflux symptoms, no heartburn at all, but he had inflammation of his vocal cords caused by reflux that he was not even aware of. So he got on GERD protocol, elevated his head of his bed, didn't eat large meals late at night, stayed away from things that increase acid production like alcohol, got some antacids and H2 blockers, and eventually the inflammation on the pharynx and the esophagus, the vocal cords went away, all the hoarseness went away. He was totally getting an effect of reflux, had no symptoms of reflux other than hoarseness. And he was totally unaware that could be caused by reflux of acid up from your stomach. So sleeping can be very tough positionally and very helped if you do it right.
Yeah, that's really interesting because isn't it true that if you go see someone in primary care, one of the differentials that you should think of if someone has chronic cough is possibly that they also have reflux that they didn't know they had?
Yeah, totally, totally. Chronic cough is one of the biggest signs of chronic reflux.
That's so because I'm sure you must see a ton of people with chronic cough. It's become like a new epidemic.
It's
And
one of the most common things.
thank you. Let's talk pills so we can talk about your expert recommendations combined with some of mine. So let's get the pills out of the way. Does that sound good? It's nothing
Sure.
against pills, but I
Yeah.
think it's always easy to give away pills or talk about pills. So let's talk about the first one that gets all the attention. Let's talk about melatonin. All right.
Yeah.
And so the good news about melatonin, I decided to put some up things because I know you deferred to me a little bit, but I want to show you. I thought I'd make a sign that you would find very interesting. And I call these the Moyad miscellaneous melatonin moments with Dr. Instant Rice. So now you know why I call you Instant.
Okay. Yeah.
What I think a lot of people don't realize is that if you take massive quantities of melatonin, if you overdose, and maybe you've seen this, if you take too much melatonin, you start going in the double digits, that essentially it can start wreaking a lot of havoc. It can actually cause daytime fatigue. You can get some of the side effects of the. So I don't know if you see this. The reason I put testosterone here is that in the old days when I was first starting out 35 years ago, in prostate cancer, they were combining huge doses of melatonin in some studies with different types of therapy. And they suggested that there was a testosterone lowering effect, but some studies were seeing that when you took mega doses of testosterone, it affected your LH. So your LH got blunted. It couldn't stimulate the cells in the testicles to make testosterone. So even though we talk about all the things that affect testosterone, melatonin is probably not one of those, but in some people that take massive dosages of melatonin, they can run into a lot of problems. And so I
Yeah.
don't know if you see that problem, but I just think there's a problem today with too many companies selling high dose over the counter melatonin. What say you about that? Do you agree or
Well,
disagree?
I totally agree. And in fact, some of the studies that I like the best, I think are most accurate, show that the best effects of melatonin when they are used at very low dose, 1 or 2 milligrams melatonin, not 5 or 10.
Exactly. So I talked to a researcher long ago in my career who did a lot more melatonin work than I've done. I said, what's physiologic? So what's a physiologic? Like when your body makes melatonin, let's say you listen to everything Dr. Rice says, because I think what we think we have to reiterate is that you tend to maximize your melatonin output when you listen to Dr. Rice's sleep hygiene steps, right? When you
Right.
create darkness, when you get away from blue light, all these things. An ancillary effect that people don't recognize is they are optimize their melatonin machinery. How about that? So I asked the guy, if you optimize your melatonin machinery, what is the physiologic level? Is it 5 milligrams? He said it's between zero point 0.5 and 1 milligram. And I'm going, nobody takes zero point 0.5 to 1.
Yeah.
But your body is saying, I do really well at zero point 0.5 to 1. So I just found that really, really interesting. And it makes you realize I'm not saying that 5 doesn't work or 3 doesn't work, which is very common. I don't know where people are getting these recommendations. They're supposed to be taking 10, 20, or 25.
Well, there's a tendency to think that if a little is good, a lot's better. And if
Yeah.
if two doesn't help me or three doesn't help me, then I better take five or I need 10. And what you're doing is you're upsetting your normal basic physiology. We say what you do during the day, set yourself up for how you're going to spend your night. And if you same with the night, if what you do is you try and short circuit the melatonin receptor site neurotransmitter mechanism, all you're doing is decreasing your own body's ability to help itself by secreting the normal amount of melatonin that your body wants to get used to responding to. And if it gets used to being exposed to more, then the response is going to be less. You develop tolerance to it, and basically it's addiction.
Yeah. I think that the pilots got it right, right? It's used for jet lag. That makes sense. They don't use it continuously. They just use it when they are going a certain direction. When they want to sleep at the time they're going to end up being at, whether it's in Turkey or
Right.
Austria or wherever, you name it. And I think that it's one of the most common items used for jet lag overall. The other thing I like to say is that people forget that a lot of healthy foods have melatonin, but the dose is really small. I don't know, tart cherries, for example, fish. So people don't realize that there's actually melatonin in some healthy foods. Nuts like pistachios have melatonin. So that's kind of cool, I think. You eat healthier, you kind of get natural melatonin, although these dosages are really tiny. They can pick up the compound in the lab.
Right. And it's all your brain needs. Really, that's the deal.
Maybe exactly. Quality control issues. I cannot emphasize this enough. Every study that I've seen from colleagues, every time they take out 10 different companies, a very large number of them will report an amount of melatonin that is either not accurate. They've either put too much in there or too little in there. So one of my rules is that you look for melatonin by itself as a compound, not stacked up with 20 other compounds, which is a good way to make you pay more without research. And you look for a third-party quality control seal, a company that's tested that company to make sure that if they're selling you 3 milligrams of melatonin, that that's what you're getting. I don't know what you tell patients about drug interactions, but to me, you're only as good when it comes to drug interactions and OTC, you're only as good as your last literature search. And what that means is, we think now with melatonin, there may be some interactions with some blood pressure medications. Maybe your blood pressure drops a little bit more when you sleep, some anticonvulsants. There may or may not be some interaction with some blood thinners, but I don't know what you tell your patients about drug interactions. I find that it moves so quickly that I think more physicians and medical professionals should be just always updating and checking their interactions or talking to a pharmacist or making sure the pharmacist is involved when the person goes to the pharmacy to pick up the OTC. That's a lot there, but I don't know what you think about that.
I couldn't agree more. I think that there was a couple of studies recently that showed getting samples from pharmacies, actually in the US, Mexico, and Canada, that especially over-the-counter supplements that were not branded,
Yeah.
30% of them had stuff in them that wasn't supposed to be there in the ingredient label, and about another 30% didn't have in it what was supposed to be in them. So the quality control of those substances is very, very poor because they're not FDA regulated or monitored. And so the last thing I tell people, don't get Joe's Garage vitamins, get them from a basic brand that, like you say, has a third-party quality control seal of approval on it. And then you're much more likely to have in it what you want. And I think you just have to be very careful about adding and adding and adding. I learned very early in my medical career, we had a nursing home across the street from the hospital. And as a freshman doctor, student Dr. Rice, go over there and look and listen, poke, prod, feel normal from abnormal, figure out what it is. And you're now the doctor for those patients. And what we found was that as repeated rituals of doctors would come through, they'd rotate in, rotate out, rotate in. Each doctor that was there wanted to give more medication to control any symptom that was abnormal. And you ended up with patients on a giant list of drugs. And the first thing we learned to do was to stop all the drugs. And amazingly, how many people, when they're on 10 drugs, you stop 8 of them and their symptoms totally go away. So polypharmacy, especially with over-the-counter supplements, can have all kinds of unknown effects where one interacts with the other and either prevents the interaction or prolongs the interaction or makes it worse. And patients have no idea.
Yeah, is exactly right. I find that some of the lowest cost melatonins have some of the best quality control. We just got a get together with the residents, and I said, if you remember nothing else from tonight's dinner, I want you to repeat this Dr. Moyad saying, if it costs more than Costco, then maybe you're paying too much. Meaning that Costco carries a strong line of supplements, but what they do, whether or not you like them, most of them or many of them, you can see the seal on it. You can see NSF, you can see USP. They have the third-party quality control seal right there.
Right.
So we're not saying you shouldn't spend more. I'm just saying, just so you know, when it comes to me, when I spend more than if it costs more than Costco, then a lot of times I'm not buying it. And I'm not saying that because I'm cheap. I'm saying that because they carry quality control seals. So does CVS, and Walgreens will carry them. But it's an important point on drug interactions and what you said. Polypharmacy, another big problem with sleep. You're just loaded up. Polypharmacy can happen with supplements too, as you see. And the name I learned was deprescribing, right? That's when you start taking away. So how often do you recommend your patients relook at their med list and their OTC list?
Oh, we do it with every quarter. We do it.
Really?
Yeah, because they may go to other doctors and they add on. And so Every quarter, we take all our patients that are in our program and we review every medicine they're on and talk about that. And you mentioned something that's important too. Pharmacists now have software where the patient can ask the pharmacist, plug in all my drugs that I'm taking and all my supplements and see what the interactions are. And they can give you really good information about that.
Good point. That's a really good point. I mean, that's their business, right? Keeping up
Yeah.
with their interactions. Ask the pharmacist. Okay, so now that we said pros and cons of melatonin, we're going to leave melatonin, but I always never like to leave a supplement unless it also gets its due in the scientific world. There's a condition that all of you can look up called REM sleep behavior disorder. I don't know if you've dealt with it much in your clinic, where someone is in REM sleep and they actually act out their dreams. So rather than when they're in dreams, if they're punching or throwing or kicking, they do that.
Yeah.
And it can be an early sign of a problem, right? So if you go to Mayo Clinic or you go to the journals, there's not many treatments for it, except there's a couple treatments for it in terms of pill. One of the treatments that's still listed as, I argue, standard of care is melatonin. And I just always found that interesting. So when a doctor tells me that, or someone never tells me that supplements are worthless, they don't help any medical conditions, that's just one of 100 examples in my head. Well, that's just not true. Melatonin is recommended in that situation. So are other prescriptions, but I don't know if you see that condition. I just thought I would throw that out there.
Yeah, we see it sometimes. But more often what I see is the parasomnias that occur when people are on the prescription like Ambien drugs, where they actually have quite complex motor activity with no brain control over it, because those things aren't working because the drug has basically shut that connection off.
That's interesting. And the other thing is people sometimes get things confused with sleep. There's another condition that I'm sure you've dealt with, which I find interesting too, is related to a nutritional blood test for some patients called Restless Leg Syndrome. So if you look in guidelines in other places, it says if you have restless leg syndrome, ask your doctor about X, Y, and Z, but also ask to do a ferritin test. Also ask to see what your iron levels are, because in some people, low iron levels are associated with restless legs. So do you see that, or is that not still as prevalent as the other stuff we're talking about?
No, we see quite a few patients that have restless leg syndrome. That's one thing that sleep monitoring can diagnose, how much leg motion there is.
Yeah.
A lot of patients can complain of that a lot, and that's not a one size fits all kind of a thing. There's lots of reasons why different people have restless leg syndrome. It may be magnesium levels, it may be stress in their life, it may be just poor sleep architecture, or having legs move. Some people think they've got restless leg syndrome and they really don't. They've got other things going on. So you really have to sort it out, but it is actually quite common. I mean, it's not the majority, but it's not unusual that I see it.
But it's multifactorial, right? It's exactly what you said. I mean, some drugs, some interactions can cause it. But as we leave melatonin, I want to tell you where this was in my own family. And I was dealing with some people who were helping a family member with hospice. And I thought this was a really educational moment for me. They were recommending all these sleep aids. And I talked to one of the medical people there that was handling this family member. And I said, this came out a while ago, a prescription. It's a prescription melatonin agonist called Rozerem. And they said, there's a prescription melatonin. I said, there's been a prescription melatonin that's been out for almost 20 years. It didn't get many commercials. But if someone's really nervous, but they want to try melatonin, there's a prescription melatonin agonist called Remedies, or also known as Rozerem, and these come in at dosages of 8 milligrams. And I find that a lot of people, you mentioned it in your lecture, which is why I showed that sign. I find that a lot of people have no idea there's a prescription melatonin out there. Have you used it? Do you like it?
I have used it. Yeah, the half-life is appropriate. It's not real strong, but it helps melatonin that you have work better. So as it says, as an agonist, it works with the melatonin that you have. So it makes your own melatonin maybe be a little bit more effective. And like you say, I have no problem with people trying those things as long as it's limited time. And I like it, the people I use it primarily for are executives or family members who travel different time zones, or athletes who travel and have to compete in a different time zone, 3, 4, 5 time zones away in the next day, and they've got to compete. You want them to sleep well. So for 2 or 3 nights to reset their biological clock, the new time zone, fine. But I just always warn them, don't start doing it on a regular basis. It's a short time thing. It's a quick fix, but it's not meant to be chronic.
I'm going to tell you my final melatonin story. You're going to enjoy it. Are you ready for this melatonin
I'm
story?
ready. Hit me with it.
Again, because I will defend supplements to the death as much as I'll criticize them. That will help legitimize the field. Not me just saying that they all work for everything, never take a medic. That's too much. It's like someone telling me that their football team is always the best, every other team stinks. Well, maybe that's the truth in terms of Michigan football, but that's a whole other story.
Yeah.
But the truth of the matter is, I go over to Italy with my wife, and then we talk to this doctor. I had trouble sleeping. And the doctor tells me that I can get a prescription of a drug called Circadin, Circadin. And I thought, wow, this sounds magic. What's the dosage? He said 2 milligrams. It's prolonged release Circadin. It's approved in the European Union for primary insomnia. You can see it as a commercial. And I thought, well, let me look this up first. I looked it up. It's 2 milligrams of prolonged release melatonin. It's a prescription over there. It's over the counter here in a prescription. Don't you find it interesting that one of the biggest sleep aids in all of Europe, I think they also sell it in a variety of other countries, is 2 milligrams prolonged release melatonin. They've had tons of clinical trials, and it's melatonin, but it's prolonged release, so the half-life's better. I don't know why. I thought you'd like that story of mine. Okay. I want to talk about, before we go into the experts' recommendations that I have, and then we'll go back and forth. Can you talk to me a little bit more? I think home testing, or even if you can pick up something,
Yeah.
some of them have these actigraphs, and there's a thing called Aura Ring now that can do some testing. I think any of these, just to see how you're sleeping, are really good. I think the home sleep apnea test or the home sleep test is a game changer, because you remember, like I do, anytime someone wanted to get tested, they're like, wait a second, I got to go to a laboratory. They're going to hook me up. I got to sleep on some gurney, and all these people are going to be watching me behind some booth. And a lot of people just couldn't sleep there. So I don't know if you want to comment more on, have you found homes? I mean, all the societies are now recommending it, the major sleep societies, but I think this is a word that no one's ever used, game changer. I'm just kidding.
No, I agree.
I think it's a big deal. Is it a big deal to your practice?
Yeah. Some people like data. I'm one of them. I like data. I like to know what I'm doing. I've got a basic concept. Most people aren't aware of the prices they're paying for the choices they're making, largely because they're not aware of the consequences of their choices. So I like data. I like to know what is, and I think that a lot of people are now, with all the technology that's available, really liking this. You can get addicted to data too, and it can worry you like crazy and take it to the extreme. But I think these Aura rings are a good example. I can't tell you how many patients I have now and friends that are using Aura rings. And it's like, what gets monitored gets addressed. Well, if they're aware because of their Aura ring that they're not sleeping well, or the quality of their sleep is worse, or their heart rate is greater, then they're going to be more apt to wonder why and want to do something about it. So I think home sleep studies kind of fall into that category. It gives you really good information for most people. It's not as good as a, all night sleep study in a shopping mall somewhere where it's all regulated. They can test more things there. They can wire you up more. But at 90%, most people don't need all that extra stuff. Most people, if they do a home sleep study, they get all that they need in terms of useful information that the doctor can then say, okay, based on that, here's my recommendation for what you do about it. So you can measure blood pressure responses, you can measure heart rates, I was amazed to see that this one that I was surprised to, they knew exactly how much time they spent on their left side, on their right side, back, front, when they woke up, how often they had sleep apneic episodes and how long they were, and what their position was when they had them. Amazing information that really enlightened the patient about what the issue was to be addressed. And so I think it's great. I think
so you're a fan of any sort of test, including Aura Ring, trying that, setting up with your primary over just a home sleep apnea test, for example. It's really called a home test, a sleep test. So any of that you're a big fan of.
All these wearables, heart rate monitors, it's amazing now, all the wearables, the information that's giving the doctor's office, and some of them are the doctor can monitor real time in the office based on signals that come by. So I think in the future, wearables are going to be more and more important, and it's going to allow us to do more precision medication than we ever had before.
Okay, so we talked about supplements a little bit. I mean, I can talk about with later on the Q&A, which shows about valerian and some of these other ones that don't get as much press. And I'll tell you the concerns I have with some herbals and some of the positives, but the diagnostics are better. Then you have melatonin prescription or non-prescription overall. Before we go through your list, do you want to say, I think the best way to think about prescription meds is who do you like on a prescription med for sleep and who do you not like off of the top of your head? I mean, who is a really bad candidate and who actually may be a candidate? I find that everyone, when a prescription sleep aid, everyone thinks, oh, that's success to sleep. Then you have a million people asking for it.
Yeah.
The actual people that qualify. So I'm just kind of trying to pick your brain a little bit. Who do you think actually qualifies for an Ambien or a
Yeah.
Lunesta? Yeah, not to throw you a curveball, but I'm just wondering who gets them in your clinic once in a
Yeah.
blue.
The people I feel good about prescribing them for
Yes,
are
better.
basically people who don't really beg for, they don't want them. They don't come in saying, I've got to have some sleep aids. They go, I'm taking this trip. I'm going to Europe. I'm giving a big talk, and I want to have good sleep before that talk because it's for a big board meeting or whatever. And I just want to make sure that I'm not fatigued when I'm doing that. Do you mind if you give me a couple days of whatever? So they
Okay.
understand it's short term. They understand what they're using it for. They know I've got a 12-hour or 13-hour sleep thing on the plane, and I know I can never sleep because my knees are up in my chest, and if I don't have something, I'm going to be just sleep deprived the whole time. So it's somebody if they've got a particular circumstance, they know it's temporary. They're not typically on medications. They're not on other psychiatric medications that could interfere with those medications.
Yeah.
And they're very conversant. They're willing not to take it if I tell them not to. So it's the ones that I worry about are the ones who are afraid that they can't do without it. They're wanting more. They've had it before. They've tried this one. Now they want to try that one. It's sort of an ongoing thing. You get a feeling with some patients that this is going to be a problem. They're not going to be able to get off of it. And if I give it to them, I'm going to have a problem controlling it from them psychologically.
That's a really good answer. I think that kind of puts it in perspective. And before I leave the prescriptions, because that's a whole other lecture and game. Have you ever dealt with prescription fugue, which we called it in the business, where you read it in the label, it says just be careful. Some people sometimes do things while they're sleeping. They'll operate machinery
Yeah.
or a car, and they wake up the next day and they don't remember. They call it
That's the parasomnias. Yeah.
parasomnias. So have you actually dealt with that where people
Yeah.
have?
I had a lady call me. She was a well-known actress in Hollywood, and one of her biggest problems was weight, and she was very well known. And she called me crying, saying, "I woke up this morning, and my entire kitchen was destroyed. My refrigerator door was open, everything in it was opened, wrappers of everything on the floor, everything had been consumed." Obviously, it was me. There's nobody else here, and I remember none of it. That patient was on Ambien. And had Ambien from that was a parasomnia, where it's like some patients have, gone to 7-Eleven, they've driven to 7-Eleven at night, got something, come back, and they don't remember it in the morning on prescription sleep medicines. So there can be disturbing things that can happen where people can drive, and they can do very complex motor activities like driving. They have no idea what's going. So the risks of self-harm, other people harm, whatever, or just things like eating too much at night,
Yeah.
not good.
The only other thing I can say about prescriptions that I wish we have time to talk about, but we really don't, is I find it interesting that these weight loss drugs are now making people sleep better. And I think it was semaglutide or semaglutide, any way you want to pronounce it, I think got approval for sleep apnea, obstructive sleep apnea, or maybe both of them now. I can't keep up. And I just think, here we go. All this weight loss is now going to get multiple approvals throughout all these medical disciplines. And the common theme is they lost weight. So I don't That's not a bad thing. It's just amazing how GLP-1s are getting all these indications now, including you sleep better if
Yeah.
you lose a certain amount of weight.
Well, it's just incredible. What started out as let's control blood sugar, and
Right.
they're finding, well, you can control blood sugar, and if you do that, you lose weight, and if you lose weight, there's less heart disease, and if you lose less heart disease, there's less mild cognitive impairment and less dementia, and it's the same thing. This is all about self-induced mortality. We're with exercise and healthy nutrition and weight control, everything gets better. And that's a drug that, for better or worse, is helping people lose weight. And it's getting I've got a lot of cardiologists now that are really encouraging patients to be on those medications because they find when they're on them, their blood pressure is better, their cholesterol is better, their inflammation markers are better, and their health is better.
Look, if we do this interview a year from now, Zepbound and Wegovy and all the ones who get approved in the future are going to have 20 indications for what they make better.
Yeah.
And I'm going, okay, but just so we all agree on what the mechanism is anyway.
Yeah. The
I think those
problem,
drugs are great, but I think
the big problem with those is, again, what if you follow these people over studies, when they stop first of all, they're very expensive right now. People can't afford them for a lifetime. When they stop them, they're going right back to where they were before because they've never learned the discipline of changing their lifestyle like those medications allowed them to change without having to think about it.
Yeah.
So, knowledgeable lifestyle is the critical thing, and being willing to and again, if they don't exercise doing resistance training, half the weight they lose is muscle weight, which is not what you want to lose at all. So it's got all negative sides. You got to know the whole story.
Well, I just wish people to say, this is those are serious drugs for serious weight loss. People have life-threatening weight. They're carrying life-threatening weight. Those have been miracle drugs. But the idea that I want to lose 4 pounds because I got to go to some party and put me on that and pay my doc cash, I'm going, ooh, I don't know about that, but don't get me started. One more pill that kind of makes me wacky, and you mentioned it, thank goodness. OTC PM medications is Benadryl. The primary ingredient in your OTC and PM medications, there's so many, is diphenhydramine. You said that. And I wish it would instead say, helps you fall asleep faster, OTC Benadryl, but nobody says that, of course. So
Right.
these sell really well, these over-the-counter PM, PM,
Yeah. PM this, PM
Advil,
that.
PM, yeah. But you're taking Benadryl, and do you have any more comment about that? That always kind of scared me.
Well, it's again, it's a the biggest problem I see regularly with patients is a hangover effect. They say I went to sleep, but then I couldn't wake up in the morning. I felt drowsy in the morning, groggy for the next couple hours after I woke up. So the half-life of them is such that it can cause a hangover effect. That's one of the bigger problems. And it's also something that if you take it on a regular basis, you become tolerant to it, and then it doesn't work as well. And then you're averting the whole deal.
And that's what I find, every time there's a magic pill, even a melatonin, you take it too much, you take it too often, there's daytime grogginess, people develop intolerance. And by the way, I think you know this. I have to review a different article every month for physicians so they get credit. I've been doing that almost 20 years. This is the one I wanted to review. I just think you'll find this interesting because you mentioned this too. This is by Young et al. This has been Alzheimer's and dementia. This just came out. So let me just read this to you.
Yeah.
This was a good study done at the University of Texas Health Center, and it got a lot of attention in my field. Here's the highlights from this observational study they did, which consistently supports previous observations, but for some reason this got more attention. Sleeping greater than 9 hours per night was associated with worse cognitive performance. This association was stronger amongst those with depression. Long sleepers were more likely to report symptoms of depression. Sleep may be a modifiable risk factor for cognitive decline. In other words, we're supposed to get a good thing, but we're not supposed to overdo it, which is what you said. Do you want to comment on that? Is this the idea that you stay in bed all day and sleep 9 or 10 hours?
Correlation doesn't prove causation.
Right.
And because people sleep longer doesn't mean the sleep caused them the problem medically. The reason they're sleeping longer is because of those other things. If I'm depressed, I'm sleeping longer because I just don't want to get out of the bed. I want to pull the covers up over my head and not face the day. So people that are depressed are going to have less activity. They're going to have more weight gain. They're not going to eat properly typically. They're not going to have as good social relationships. All those things have all the negative effects that we know of. It's not the sleeping that does. Sleeping is a cause of those things. Sleeping is a mechanism that people use to cope with those things, but it's not a cause of the medical problem other than the fact that they're not doing all those other things.
Yeah, it's a symptom of the greater problem. It's a consequence, right? But
That's
that's
right.
why it's such a powerful indicator. We're not saying that if you sleep too long, suddenly you get depressed. We're saying if you are sleeping too long, it might be an indication of something going on, something else
Yeah.
going on.
Yeah.
And that's why I've always felt like this is the most powerful part of your talk. I kind of summarize the expert's recommendation, including yours, because when you really hone in on these recommendations, these are pure power. And a lot of them is lifestyle. And let me go through them and we can both comment if you want.
Yeah.
The
Good.
first one that I thought changed my situation was the fact that many of the sleep societies do say 60 to 67 degrees Fahrenheit or 15.5 to 19.9, 19.5 Celsius. Man, converting that to Celsius without using a computer
Yeah, I
would,
know. Yeah.
oh my gosh, you got to help me. So the idea that at night, so we sleep at 65 now. And I don't know if you want to comment on that. The body was meant to sleep in a colder state. So 60 to 67 is the general recommendation from the National Sleep Foundation. What say you about that same temperature range you mentioned?
I totally agree. I find personally one of my biggest issues if I go to a hotel and
Mm.
I sleep on a upper level story of a hotel, and if I have the air conditioning on to keep it cool, the noise can wake me up. If I turn the air conditioner off, it gets hot because the heat from the other floors comes up, and then I'm hot. And so that can't fix both things. I think that the body temperature naturally cools down, as I said, when we sleep. Our normal core body temperature goes down, and we need less warmth in the room. We need covers, but we need less room. So most people sleep well. Studies are pretty clear that they sleep better if it's around 60, 65, 66 degrees as opposed to 70 degrees. And many people wake up because they're too warm.
I think that's so powerful. And a lot of people would say, well, you mentioned this. Well, I took a hot shower and that helped. Yeah, because you took a hot shower, you come out of the hot shower, then the body cools down very quickly. So it's actually the cooling effect that's helping you sleep. In fact, I had to review a paper many years ago. I didn't realize, and I had been there to give a lecture, I didn't realize that the country with the most saunas per capita is Finland. Finland has over 3 million saunas for a population of about 5.5 million. So I spoke in Helsinki and Lapland, and they were telling me how the sauna is the elixir, and especially they would use it at night before they would go to bed. And then I began to realize, well, wait a second. That's awesome, but that's like the hot shower effect, right? They go in these saunas, come out freezing cold, jump into bed, and I don't know if you thought that. I just thought that was fascinating when I was over there.
Yeah, I think that anything you do like that is just what you're doing is you're relaxing yourself. It's part of it is mental. You're mentally, if you go into a sauna or a jacuzzi, you're mentally going, it's a diastole, and so you're relaxing. Your blood pressure is going to naturally go down. Your pulse rate's going to go down, and reflexly, as you say, your temperature is going to go down too.
The next recommendation is, I should probably hide these. You mentioned quiet, dark area. It should be quiet in your room and very dark for sleep sex. We won't talk about that extra part, but now here's what I found. I have found the darker the better in the room. And one of the tests I use, because I know when I travel, when I'm in a hotel, if I can read my hand in the room, there's too much light going on. So in our bedroom, I can't see my hand. I can't count my fingers. It's so dark. We've used dark curtains, dark blinds. And I have found that pure darkness really helps. And I find it so interesting that my wife got one of these gifted the other day for her
Uh-huh.
birthday, right? And I can't, yeah, I mean, I love these things. People like them. I can't use them. Instead, I just want the room really dark. But the concept's the same, right? The
Yeah.
darker, the better, right?
We sleep often because of lack of stimulants that wake us up, and light wakes us up.
But yet we're surrounded by light. I
Yeah.
find it incredible that the fire alarm has a light, the extension cord has a light,
Yeah. The
the
nightlight has a light.
the night light has a light. And so people need to start getting rid of those or blocking those.
Yeah. Even, like cell phones and LEDs have lights, those things actually change us too.
Yeah.
So, I read one study, I don't know if I believe it or not, but they shined a laser light, a LED kind of light on somebody's leg and it changed their brain waves. I'm not sure how far you go with that, but I think that all these clocks ticking, clocks
Yeah.
that tick or little clocks that they're light enough you can see them, that's enough to affect your eyes, and anything that stimulates your eyes stimulates waking.
Well put. Here's one area we didn't get to talk about, but I have put in a lot of attention, and that's mattresses and pillows. Don't you find it
Yeah,
amazing? Don't you find it amazing that you spend a third of your life sleeping, a third of it, yet we invest probably the least of anything else in our house? So I have started paying attention to consumer reports, looking at foam, innerspring mattresses, which one's better if you have hip pain, which one's better if you have back pain. And a lot of these societies now rank them. So avocado green, for example, is ranked really high and with some categories, purple. And same with these pillows. And I'm thinking, as of this year, we invested more in the mattress and the pillows, and I feel that's your equipment you're sleeping on the rest of your life. Why aren't we putting more money in that? I don't know if there's a question or a comment there, but I just find it so fascinating that not more people invest in the equipment.
I agree totally. I think for me, the reality is most people are not aware of what equipment they would do best with.
Right.
And I think it's not a one size fits all. I think because of people's maladies, neck, cervical arthritis, or whatever, what pillow is right for you and it may not be the best pillow for me. But I think what I would urge people to do is to try different things and figure out what ergonomically allows them to sleep in the most comfortable way for the most time at night, and not to assume that just because it's a new bed, it's a great bed. Some people
Yeah.
do better in a soft bed. Some people do better in a firm bed. And sometimes you got a spouse who likes one thing and you like the other thing. Now, we just actually purchased a new bed for a place up in the Sierras, and they had these mattresses that cool things, the cooling.
Yes, the cooling
Yeah.
mattresses.
So I think there's lots of ways to spin that. And I think I would urge people to be aware of the great variety of things and the health. I don't know if that's the brand, the Healthy Back Store. There's all
Yeah.
kinds of stores now that make things that have memorable foam and so forth. Try things out, see what works for you. If you're not sleeping well, change positions, change structures, change textures. Something's going to work best for you. Do what works best.
Yeah, I can't. We've now tried a bunch of different stores. We tried the Purple store, Sleep Number bed, where someone wants their bed up, the other
Yeah.
person wants their bed. I mean, there's a whole game going on out there that is medical that we need to be jumping all over that stuff. The
I had
next
a patient, I'll give you an example of that. You got a bed that the top of the bed raises, right? And
right.
they had reflux. The gastroenterologist said, you got to raise the bed 6 inches high. So they did. And they can't sleep on their back because they've got, sleep apnea. So they got GERD, they got to raise this. So now they're sleeping on their stomach with their back elevated, but now they're in an extension position of their spine and they've got low back pain. And so they're sleeping in a position that helps their GERD, but screws up their back. So you gotta, lots of different parameters, but be aware of what you're doing and what it's causing and figure out what works totally for you.
Yeah, there's a science behind this, right? It's almost as if medical teams should go, by the way, what bed did you purchase for yourself and why? And I bet you a lot of people, I don't think a lot of doctors could answer a single brand and why it might be superior for them. I have really found that Consumer Reports has done an incredible job breaking down the different companies, the different beds, the different pillows, and I just couldn't stop reading it. Anyway, that's just my
Yeah,
thought.
I like Consumer Reports a lot, just for
Yeah.
that reason.
Exercise. We're moving down your list. Okay. Are you telling me there's some thought that if you exercise in the evening, that can keep you up, that you should exercise in the morning? I'm a morning exerciser. Exercising in the afternoon, evening just doesn't make any sense to me. But what say you in terms of how much exercise and when in the day, ideally, so it knocks you out, makes you more sleepy? And by the way, I think you pressed on it. What I keep telling people is exercise helps you get into those more deep phases of sleep as you get older, because you get robbed of that with age.
Yeah.
And so exercise does a heck of a lot for you. Plus, in the area of urology, we know you get up less at night if you exercise. What's your take-home final points about exercise and sleep?
Studies are very clear. It doesn't much matter when you exercise, other than vigorous exercise, max exercise aerobically right within a couple hours of bedtime. It it decreases your hormones' ability to totally relax everything right when you want to go to sleep. So it ought to be no more than 3 or 4 hours before bed, right?
Yeah.
But studies are pretty clear that people do regular aerobic exercise, not so much strength training, but aerobic exercise that stimulates the cardiovascular system. There's a reflex relaxation component that makes us more sleepy at night.
Mm.
People sleep better. And there are people say, when should I exercise? There's another study that looked at people that are types of people. And they had animals for the different types of people that there were. There were wolves who stayed up later at night, and I forget who it was, woke up early in the morning. But some people are morning exercisers, some people are afternoon exercisers. I tell people, I don't care when you exercise. Do it when it feels best to you and when you like it best, when it fits in with your lifestyle, and when you're less likely to omit it because it doesn't fit.
Yeah.
Well, like you, I'm an early exerciser. What I find for most people is if they put it off, don't do it in the morning, I'm going to do it in the afternoon, something always too often creeps up that seems more important at that time to exercise, so they don't do it.
That's a good point.
I said, do it when it's not going to do it, like when it's going to be an appointment, and you'll do it every day because it's in your appointment book, and you're more likely to do it because it fits in with your lifestyle and your occupation or whatever it is. Some people feel better exercising at certain times of the day. Okay, exercise, make it so that you can do it at that time of day. There's no data, hard evidence based, that says it's better to exercise physiologically in the morning than in the afternoon. It just, most people don't do well exercising right after a heavy meal. So it's got to be at least, a couple hours typically after a meal. But whether you're a morning exerciser, an afternoon exerciser, or an early evening exerciser, it doesn't really matter as long as you do it and you enjoy it and you do it at a time when you're more likely to keep it up.
I like that. You know what the next one is? We're halfway down. We're moving through. It's getting easier. Limit caffeine, especially in the afternoon. Limit caffeine, especially in the afternoon. My take on caffeine, before you say anything, I want to throw this out because I often pass ideas to you and vice versa, and then you do some of these tests. I have become fascinated by this newer test that's available online, and some doctors can order it. It's a caffeine metabolizer test, and it's a gene test. It's the CYP1A2 gene in the liver that metabolizes about 95% of the caffeine. Caffeine's also metabolized in other places. And what we found is that research has shown, not definitively, but it's shown that there are slow metabolizers of caffeine and fast metabolizers. And through the test, I have friends, you know these guys, they can pop, and gals, they can pop caffeine at work all night and day, and they sleep like a baby. And I know other people like myself, if I have caffeine after 4 p.m., I'm wired at 2.
Yeah.
And so what I'm saying is, I'm not saying this is a definitive test, but the CYP1A2 gene test, this is really interesting, and a lot of companies offer them. So if you're one of these slow metabolizers, it might explain your anxiety. It might explain your tachycardia or your fast heart rate. And if you're a fast metabolizer, it might explain why you can have 3 or 4 cups of coffee and not feel anything. So I don't know if you started to use that or you talk about it, but I'm not a big fan of doing a ton of genetic tests or recommending a ton of genetic tests, but I just find this one fascinating because we're all obsessed with caffeine on some level.
Nobody really needs caffeine to be awake, right? Conceptually, many people just have programmed their brain to think that they need it. Otherwise, I'm not going to be awake today. I can't focus this afternoon unless I have caffeine. So if they think that, that's probably going to be true. That's placebo effect, right? Having said all that, I think you're exactly right. There's some people that tell me, I drink caffeine at night. It doesn't bother me. I sleep fine. Should I stop it? I go, no. If your blood pressure is fine, you're not getting ectopy, you're not getting irregular heartbeat, you sleep fine at night, I wouldn't worry about it. You don't need a genetic test. You're sleeping fine. But if I'm not sleeping well and I can't stop from waking up at night and I can't go to sleep or whatever, and I have caffeine, knock off the caffeine and see if it makes a difference.
To me, in a lot of ways, you're my personal physician for a lot of things. If you ever told me to stop caffeine, I might come over and I might hurt you. Maybe I'll emotionally hurt you with some sarcasm. I'm just saying, I just have to have my cup of coffee in the morning, and then after that, I can slow it down. But I'm definitely, this is a cheek swab. It could be blood, but I'm just
Yeah,
fascinating. I would be fascinated to know what your gene test says. I think you and I should get them and come back and report
I'd
the
like to get
results.
it. Give me information. I like it. Most people do fine. The statistics are 1 or 2 cups of caffeinated beverages a day for people, not a problem.
Yeah, but I just think for those of you out there, if you want to just cut to the chase and figure out if you're one of those slower, fast
Yeah.
metabolizers, again, it covers about 95% of the metabolism is CYP1A2 in the liver. But it's one of those tests I just find fascinating. Alcohol and or nicotine. I put yikes
Yeah. Well,
after that.
nicotine, there's no problem with that. Stop it.
Yeah.
Don't do it.
Nicotine, I think, is the easy one, right? People kind of get hit with that, but I don't think people are understanding how even one drink can affect their deep sleep. I can tell you now, I become so sensitive to it. I had a drink last night and I had trouble sleeping. I'm to the point where I'm getting older. I don't know what your thoughts are, but alcohol really, with some people, I think most people, and I looked at the data, it doesn't allow you to go into deep phases of sleep. So it might knock you out, but you're not getting good sleep. What
Right.
say you?
Alcohol is now more and more the benefits of alcohol have been wiped out. The World Health Organization has now declared there are no health benefits to alcohol. So I think we've put that one to bed. So that doesn't mean you shouldn't drink alcohol, but that don't drink do it thinking you're doing yourself a health benefit. Alcohol is now considered to be carcinogenic, and it's just a dose response level. So the more you drink, the more cancers of esophagus, the entire GI tract, mouth, esophagus, stomach, colon cancer, prostate cancer, breast cancer, all those things are increased by alcohol. And it is a dose response. And for women, especially, even 1 or 2 drinks a week does increase their breast cancer risk, which is interesting. So I think that's where you got to go. Well, what's my family history of breast cancer? Am I at risk for that? What's my genetic testing and so forth? But for sleep, I'm impressed. A couple of things you said. One was, as I get older, most people find that as they age, they don't tolerate alcohol as well. They just don't metabolize it as efficiently. It affects them more. They feel worse the next day. They get a hangover effect where before they didn't get a hangover effect. They get a headache where they didn't before get a headache when they were in college. So I think the reality is that most people, as they age, can tolerate efficiently less well alcohol, and they just have to decrease their consumption. And for sleep, as it speaks specifically, I can't tell you how many people have come in without me asking at all. They've just said, I stopped drinking. It's amazing how much better I sleep. Almost always they say if I stopped, and I thought it would be different. I thought I needed it to sleep. And now I find that it actually interfered with my sleep. And when I don't drink, I sleep much better. And so I think that like I said, there's a stimulatory effect apparently with alcohol when the blood level falls that wakes you up, and then it's harder to get back to sleep because it doesn't let you go into that deep sleep. And so I just think it's not a good thing for sleep. And if people have trouble sleeping, I would certainly give it a trial of not having alcohol and see if that makes them sleep better.
Yeah, that's what dry January did in these other dry months. A lot of these people will come back. I've had people in the family that try it. They'll always say two things. I can tell you when I worked in advocacy, I put out a Dr. Moyad challenge. Just go for a month, any month, just try it. And the letters I used to get back were always the same two letters. It was, well, I missed it, but I sleep better and I lost a bunch of weight.
Yeah.
It's like,
and I can't wait to get back on it.
yeah, I know. So, okay, these are the last few, and then we're done. This is you mentioned meals. Some of the experts are saying, I called out everything that the experts said. You said, and some of the societies, they want you to finish meal 2 to 3 hours before bedtime, which makes sense. You want to talk about that and then reiterate your carb recommendation.
Yeah, the studies show that late night eating big meals, especially within 2 to 3 hours, differentiates it screws up the architecture of normal sleep. People don't fall asleep as well. They tend not to get into the normal sleep patterns, et cetera. And I'm not sure exactly chemically all the things that are going on, but when your body is spending so much energy trying to digest food, it's taking away from the normal hormonal changes that will allow you to sleep better when you do sleep. So there's no question that late night eating for many people interferes with healthy sleep.
Mm.
And it's probably not only late night eating, it's also type of eating, it's quantity of eating, timing of eating, and what's in the food. It's all
Mm.
those three things. So I would say if you're going to eat late at night, have a smaller portion. Don't have a big meal. Don't have it be a heavy meal, especially with carbs, because sugar, again, rises your glycemic index, and that changes sleep and the attitude and so forth in your brain. So you don't want big sugar, you don't want a big heavy meal, and you don't want things that have stimulations effect in them. And probably heavy protein meals, like big heavy steak, hard to digest. So things
Yeah.
that are hard to digest probably at night, not as good also.
Well said. Here's some things I saw. You briefly touched on them, but this again, I just called all these together, and I'll give these to PCRI too, along with your 10 recommendations. How do you feel about noise machines? I have some friends that use different types of noise machines.
Masking, yeah.
Yeah, I'm asking if you want to, are you a fan of using a noise machine to sleep? Because I tried one and it just didn't work for me. I have a friend that tried one. It worked beautifully. Where are you with noise machines helping you sleep by drowning out anything external?
Well, the biggest reason for people to use noise machines that I found is people who have tinnitus. When they've got hearing loss and they've got this ringing in their ear and they can't shut that off and they can't stop thinking about it, then the noise machines can kind of drown out the tinnitus, which is caused by hearing loss.
Yeah.
What happens when you have hearing loss? Usually it's high frequency hearing loss as we age. And when you can't hear high frequencies as well, what you do hear is your own noise, which is normally drowned out by the normal stuff that you hear. So anyway, I think if you got tinnitus, then and those noise machines, the ocean noises or whatever, they can try it and see. If you sleep better with that and it helps you, do it. But if there's no other reason and you're just putting noise in there, for most people, no noise is better than some noise. Go back to it's precision medicine. If people say, when I put on that ocean wave sound, that feels better. Just that white noise, it's just a chronic, you know, whatever it is, the noise that they sleep better with that. Do what works.
Yeah, I mean that's a really good point. This is where Instant Rice comes in, why I always talk to him, and I hope he likes to talk to me. But tinnitus is a major problem in terms of going to sleep. I mean, that's that constant buzzing and ringing sound. It's a big problem with vets, for example, people in the military. They're used to big, loud noises that cause damage. The tinnitus is one of the biggest problems going on in medicine today without a clear-cut, amazing solution, right? So that's a good point that the noise machines really help with that ringing, drowns that out so that they can get the sleep. I'm glad you brought that up. That's a great one.
The only other people I'd say is if some people, because of stress, they're
Yeah.
stressed, they can't shut their mind off, and the periodic wave kind of sounds or white noise kind of shuts off their brain, makes them relax better. So, again, the issue would be do relaxation techniques, learn how to relax, learn how to use the power of your brain to help your own brain relax rather than depending on noise to do it. But if noise helps you do it, and that's a problem for you and helps you shut your brain off and just, be like a mother's breast sound, do it. If it works,
Yeah,
do it.
I mean, the noise machines now is a whole new science. There's different types of noise
Yeah.
that can be applied to help you sleep. It's fascinating, and a lot of that's over the counter. So, nasal strips, I put a question mark. I'm,
Yeah.
you know what I use nasal strips for? I use them when I sometimes go for long runs. If I'm a little congested, I feel like they help me breathe better. The
Yeah.
downside of nasal strips is I already have a pretty big nose. And when I put on a nasal strip, it makes my nose look even bigger. And so I don't want my nose to look bigger than it is. It's already big. So how do you feel about nasal strips? I mean, do you even recommend them for sleep?
If nothing else is working and people just are, they tend to be mouth breathers because their noise often is people with congestion. They've got allergies or something, or they've
Yeah.
got nasal polyps, they've got chronic sinusitis. The nasal strips can help them get a little more. But I tell them try it. It's not a one size fits all again, but if it helps, do it. No problem.
Yeah. And what I
No,
learned
no downside.
I mean, what I learned is you just got to clean your nose off first. Otherwise, it doesn't, when you put the adhesive strip, it doesn't pull correctly or it falls
Yeah.
off. So I'll clean it and I'll use it when I go running, but I wish I could use it at sleep. I think I scare my wife when I put that on at sleep. I look scary.
I'll tell you one thing that our ENT guys have really emphasized with me is that many people who can't breathe well because they've got congestion or nasal polyps or whatever, or
Yeah.
sinusitis that's chronic, if they use saline nasal irrigation before
Oh, that's a
bedtime,
good one.
now that helps really well because it just people see this kind of seems funky. You're just squirting this thing in, it comes out the other side. It doesn't feel, but people that do it, they swear by it. So sometimes if congestion is the problem, saline, warm, lukewarm, nasal saline irrigation, just with a squeeze bottle, both sides, 5 minutes right before you go to bed, can make a big difference in how well they breathe.
Ooh, that's a good one. I had a call last night from a friend in California who's having sinus problems. I said, "Are you using Simply Saline?" That's what I use. I use a
Yeah.
metered spray. It's one of the most popular brands at CVS and Walgreens. It's cost effective. I don't use it that often. I use it once in a while because you can also overdo it. But, it's a sterile metered spray. Boom, boom. It drains. There's no prep time. And that's a good
Yeah.
one. Those have really been game changers in the over-the-counter world. Here's a term that's thrown out in medicine so much, and I'm going to tell you and you talked about it. And this is mentioned in the cancer world. And so let me just put this up here. Cognitive behavioral therapy for insomnia. All right. If you look at a ton of medical journals, I don't know if this is PC or what it is, but everyone says before doing anything else, before popping any pills, going to OTCs, prescriptions, all the experts agree that the most effective way and the safest and healthiest way to work on your insomnia is cognitive behavioral therapy for insomnia. Now, the reason I first of all found that interesting is that in cancer-related fatigue, which is in the cancer world, fatigue from cancer treatment is an epidemic problem. And people are always asking what to do. And there's a variety of recommendations, but in the largest review that was ever done, that was published in JAMA, they found two things were very effective for cancer-related fatigue from treatment. One was exercise. Not overdoing it, but getting exercise was a reboot, gave you more energy. And the second one was cognitive behavioral therapy and kind of just change. So here's how I looked at cognitive behavioral therapy. I think this is also a way of saying somewhat sleep hygiene. It's teaching you about sleep, but I just want I want to end on this because if you pick up any journal, if you look in AI, it's recommended for first line therapy and sleep by everyone. Can you finish with this and tell me why this is really so powerful? CBT. I'm not talking about CBD. We didn't talk about marijuana, which I'm sure
Yeah.
you don't recommend for sleep either, but CBT, and that's how I think we should finish it, unless we should
Yeah.
finish.
No, the one of the most underappreciated things in medicine today is the power of our brain. And we give away oftentimes the power of our brain to determine how we feel to the world, to circumstances, to people we're affiliated with, to relationships, to our economic problems, whatever. The power of our brain, the power of our ability to choose our attitude and to use the placebo effect of expectation by deciding how I'm going to expect to feel and by reframing my experience to be a positive experience for me rather than a negative experience is really, really powerful at changing our brain neurochemistry.
Hmm.
And Viktor Frankl said it best years ago. He wrote Man's Search for Meaning. He said they can take away every one of your freedoms except your last freedom. They can't take your last freedom away from you. And your last freedom is your freedom to choose your own attitude in any given set of circumstances.
Hmm.
So our ability to happiness is an inside job. And people expect to just be happy because they've always been happy or whatever. And when life hits them in the face, they it's easy to blame the world for how lousy we feel or what our outcome is. And the really healthy person is the person who has the ability to internally choose my state of mind in any given set of circumstances. So if I'm not sleeping well, I can very honestly choose to sleep better by deciding that I'm going to sleep better, by reframing the experience. And rather than focusing on, I'll give you an example. I have an arthritic thumb, right? And it's one of those things I went to my PRP guy, told me PRP isn't going to help that for this particular thing that I've got. It's osteoarthritis, and it aches all the time. Not a lot. Yeah, I'm aware of it. If I don't focus on it, it doesn't hurt me at all. But if
Mm,
I want to sit there and look at my thumb, I can feel the pain right now in my thumb just by thinking about it. If I choose to focus on my thumb, it can screw up my night's sleep. And it has.
mm,
If I choose just to ignore it and I'm going to accept that, I can't change that right now. It is what it is. I'm going to focus on something else. Then I have the ability to set that aside. So cognitive behavioral therapy is understanding, I think, with cognition, what behaviors I have, both body and mind, that I can employ to put myself in a position where I can relax, I can accept what is, I can experience the feelings that I want to experience in the way that I want to experience them, and I can choose my outcome. There's a guy named Mihaly. Have you ever heard Mihaly? He's a Czechoslovakian guy. He's a emeritus professor now at Claremont Men's College. He coined the term years ago, the flow state. And flow turned into, in athletics, the zone. Athletes say, I'm in the zone. Well, the flow state was a state of mind where everything just seemed to be flowing perfectly well. Time stood still. You're loving what you do. You're totally in the moment. You're immersed in something that's meaningful and purposeful for yourself. And that's the state of flow. And what he said was about inner experience. He said, he who can control his own inner experience can come about as close as anybody can possibly come to being truly happy. And I think that's it. CBT is about learning how my body and my brain work, what I think of life, how I can reframe my experience in life to be in a way that cooperates with my own values and goals and what I want to do, and put myself in a position of peace and love and forgiveness and joy.
mm.
And by framing my life like that, like I said, focusing on counting blessings, not sheep, just if there's all kinds of stuff in our world that we feel badly about, but there's so many things in our world that we're blessed for. You can't count the blessings of my life, where we live, the weather we have, the water we have to drink, the food we have to eat, the friends we have, the education we have. Worrying about my thumb is getting it out of perspective. That's what, cognitive dissonance. That's what one of the things I said about sleep was when you sleep deprived, you have lack of emotional categorization. I don't have the ability to put things in proper perspective because everything irritates me because I'm sleep deprived. CBT, I think, is about reversing that, using the power that is in our brain and present for all of us, focusing on our feeling state rather than our brain state to allow us to feel good and enjoy our life, and to focus on what I can do, not what I can't do, what I can do to help myself feel better about myself and my life and have a great night's sleep tonight because I deserve it and I'm worth it.
Yeah, that's really well put. What I learned, what I have learned is that CBT, cognitive behavioral therapy, there are sleep professionals you can meet with on multiple sessions. They'll do it. But I've also found that over Zoom, just doing it on the computer with a sleep professional apparently has been pretty effective too. And they're saying, anywhere from 5 or 6 sessions. So it's multiple sessions, meeting with the professional, reframing, and they also provide sleep hygiene tips. They also talk about a lot of the Dr. Instant Rice tips, and that's all combined in this web-based situation or one-on-one situation called cognitive behavioral therapy. And I think you put it best. It's practicing to reframe things. And a lot of us at first go, what can that really mean? What it can mean is that what's the one thing I always, always hear? It doesn't matter. Family, friends, you name it. The advocacy groups. I can't sleep because I ruminate. I can't turn my brain off. My brain keeps going, right? And I think cognitive behavioral therapy helps you no longer ruminate. It helps you quiet down, helps you perceive it differently and look at the glass half full. But that takes practice. I think
Right.
people think like, oh, I'm just going to think positive and be positive. So I think you said it best. So it sounds like you send patients for cognitive behavioral therapy a lot.
Well, and Also, one thing that's very parallel to that is mindfulness meditation.
Yes. Well put.
Mindfulness meditation very much aligned. Just learning the power that's in my own mind to allow myself to just focus on relaxing and breathing and being present, fully present in the now, not worried about yesterday, what I did, or afraid of tomorrow. I'm just focused in the now and I'm fully present for myself. Like you said, it's a skill set and you
Skills.
can learn that skill set, but it does take practice. And in practice, you actually do change your brain neurochemistry. And that's the power.
And that's the power of the scientific method too, because that's what stunned me, that CBT, cognitive behavioral therapy, tended to beat out everything else. And it
Yeah.
became the primary mode, the
Yeah.
safest and most effective mode of helping you improve your sleep and reduce your insomnia. And I just thought, I have got to bring this up with Dr. Rice. And then when you mentioned it, I thought it's the best way to end, because what greater message to leave the audience than, if you don't think lifestyle makes a difference, look at the world of sleep medicine. The dominant theme is the most effective intervention is not a pill. It's actually working with a professional and becoming more mindful,
Yeah.
becoming less stressful, less anxiety, and practicing how to think before you sleep to sleep better.
Harnessing the power within. It's already there.
Exactly. It's so funny that you just talked about this. When I was getting my computer ready today, I had to move aside a book. Not that I read this book all the time. It's just people give me this book. They give me all sorts of books. It was the teachings of Buddha. So I thought, and now we're ending on this. That's kind of what we're talking about. It's that quieting the mind. So here we did it.
I'll show you.
Oh, there you go. There you That's right. So look, and plus then all those awards. So we covered it. The Fahrenheit and Celsius temperature, the quiet dark, the mattresses and pillows, the exercise, the limit caffeine, the caffeine test, the alcohol or nicotine, finished meals, low carb, noise machines, nasal strips, and then we finished with cognitive behavioral therapy. Just so people don't think that we're saying CBD and marijuana. You're not saying use CBD or marijuana to sleep. We're saying cognitive behavioral therapy. Am I correct?
Bingo.
Why do you think CBD is so popular for sleep?
Everybody wants the magic pill.
Isn't it funny that everyone thought it would bore out? I mean, I know it helps some people some time, but in the studies have been kind of,
The placebo effect of any of those things for chronic whatever are very, very significant.
yeah. Anyway, well, people aren't going to like us for this talk if they want to make a lot of money off of it.
I know. Well, there's uses for everything, but I think
We're useless.
you gotta look at evidence-based information.
Did I miss asking you something about anything?
I think you did it. I think you
Did
did
we
a good
do it?
job. You pretty much covered
Did you
the
like my
waterfront.
rule? Did you like my rule before we started? I said we're going to do this in 30 minutes, and I think we did an hour and a half of Q&A. Once again, I'm accurate as ever. I'm only an hour
As
off.
usual. As usual.
So before you leave, we want to give everyone a present. And what do I give the guy who has everything? I thought, well, we'll send this to you. And I am really reluctant to send this to you. So just so you know, it's new. It's got its. So here's what we're going to do. We're going to send you an official USC football cap, because I know you like to go to the games. This is painful to just hold. I feel like this is somewhat
I know it's hard for you, isn't it?
terrible. It's terrible. It's almost as bad as this. If you don't think people like to razz me, I keep showing them this. There was an ex-Ohio State player just sent me, you can't get these caps. These are ex-players. He sent me one of his caps. And if everyone's like, you got to throw that away, I'm going, I'm not throwing this away. I might not like Ohio State one day a year, but I don't mind them the rest of the year. So same with USC. I love Ohio. I love USC, Lee, Dr. Rice. I just will not like them in October when they play Michigan, and
I got you.
we're gonna go to that game together. But
Okay, I'll wear it.
USC for your lecture, I thought, to make myself feel better, this is reframing. This is perfect. I thought USC should stand for something else after the Dr. Rice lecture. It should stand for "You sleep comfortably." Oh man! Right?
Good job. Good
Oh
job.
my gosh. Drop mic, don't hand the mic, pick up the mic. How brilliant is that? So we're going to send you this cap. It's new, but I want you to remember that you're USC. You're helping us sleep more comfortably.
Thank you.
Thank you. It's always an honor.
Blessing, always.
Always an honor. And I will see you at the game.
Okay.
And we can root for our own team, but I think I'm sitting in the USC section, so I'll pretend to like USC. Thank you so much for covering this. This is a power lecture, and I thought a good Q&A, and hopefully we'll do this again, maybe a part 2 or something else in the future.
Whatever. Would love to. Thank you.
Thank
Cheers.
you.
Okay. Bye. Have a great day.